Good morning, all. The today's session is on the topic of nursing strategies to reduce health inequalities. Actually, this session is supposed to be yesterday, but due to some issues and commitments, I couldn't take the session yesterday. So, thank you so much to the foundation for giving me this opportunity and also for bearing and rescheduling this time slot for me. In time, like if the slides are not visible or is not audible, I request please let me know, and I will try to finish the session on time. I just yesterday also various sessions were there, Dr. Vasanta ma'am and all, and I have attended those sessions of her. The okay, so there where we have seen various various conditions like she was sorry we have seen various other sessions yesterday. One second, there is some glitch. I will just try to fix it first. So we will be discussing on the nursing strategies to reduce health inequalities. So this particular topic, it actually fits very well to the entire theme of this conference, that is building equitable, inclusive and sustainable health for all. So when I find this topic, I basically feel like we have to, I would like to start this topic with a very simple thought that health is a basic human right. But health equity, that means something different. Health is a basic right for everybody. But health equity means everyone should get a fair chance for good health. And this health equity of getting a fair chance for equal health, everybody should get that fair chance, is still a unfinished business. That means still this health equity is not achieved in various parts of this world. Even to majority of the places, this is achieved. So in this session, we will be discussing on the three major things. We will be discussing like what is the major problem, why this health equity is not well distributed and not well achieved, and third is what important role nurses can play, or what can be those nursing strategies by which we can make health equity available for everybody and fairly distributed. So before starting the session, I would just like to clear with the definition that health inequalities are the differences in health between a group of people that are unfair and are avoidable. So two major words are to be stressed here. That means health inequalities is something which is avoidable and which is quite unfair. And the major reason why it occurs is in the term where they are being grown up, what is their living situation, where does they work, and all these scenarios. The major idea behind this, if I say about the child survival rate, child before the age of 5. So it is very clear, like the rate of child survival, it depends on the country, whether it is a low economic country or it's a high income country, but also on which district the child is born. That is the major factor. Second is the various pandemic, like recently we had COVID-19, the climate conditions, the various economic instability. So these particular factors, what they have done, they have actually created a wide gap in health equity progression. That means it has narrowed the progress of health equity. And overall, the entire health equity can be managed or can be attained by the nurses or the midwives, because they are the trusted part of our healthcare system. The majority of our healthcare system is been backed up by the nurses. They are the backbone, right? So the nurses can play a very important role to close these gaps. If I come to the statistics, we can see that there is a maternal death that they occur all over the world, or a global maternal death worldwide is near about 92%, which is in which occur in low and the important point is that these deaths are preventable. And out of this 92% death, 454 maternal deaths, in 1 lakh live birth that occur in sub-Saharan Africa. And you will be very shocked to know, you will be very, you will be very shocked to know that in sub-Saharan Africa, among 1 lakh live birth, it is 454. But in countries like New Zealand and Australia, it is just 3. So this simple fact explains that why this health inequality matter today. It matters. Why? Because each number represents a real mother. Each number or the figure which you see in the of a real family. So before we talk about what can be the solution, what are the nursing strategies, we need to agree on certain basic definitions. So before I begin with the further discussion in the slides, the major objectives, the 6 major objectives of this session are like we will be here learning what health equity is. We will at end we will be definitely analyzing the entire global data or the global picture. We will also see the various health determinants, and we can health determinants in the sense of WHO, the role the nurses can play here, what can be the various concrete strategy where this practical evidences can be applied through evidence-based practice, and what role in the future AI can hold for nursing. So to understand this global health So to understand this global health inequalities, we have to just know that these words they matter rather than this talk. That means like if I talk about health equality and health equity, many people they just think like this word are very much similar, so the meaning is same, but it's totally different. Health equality is like it can be said like this, like providing shoe to everybody but providing a shoe that fit the size is different. That means health equality means providing the health resources, services to everyone, regardless of their need. That means whether the need may different from individual to individual, but providing that health resources to everybody is health equality. But health equity is providing people with the specific need of their health, which is very fair and which is accessible. That means the health equity is providing health care to the individual according to their needs. And health disparity, the name itself suggests that means it is the measurable differences in the health outcome. And social justice is the ethical, the just say like the moral values, the ethics, like the resources or the opportunities, it should be provided and distributed to everybody, irrespective of their income, their caste, creed, whatever. So that is what the justice is. If I talk about this global health inequalities or global health equalities, there are major four, these are the 3 important pillars or the goal, what you can see on the screen, that is universal health coverage. Universal health coverage, it's already, I think, known to everybody that it is people can access this quality of health and it could be accessible to each and everybody. That means everyone can get the quality health care without facing any money problem or any income related problem. Sustainable development goal. Yesterday, Dr. Vasanta spoke very beautifully about it. That every healthy individual, that is the promoting health and well-being. That is what SDG 3 is. So in SDG 3, the ask like world to ensure that healthy lives or health for all the ages. And SDG 10, that is to reduce inequalities. So basically, these are our equity anchors or the pillars through which global health inequality can be reduced. So let's see what are the global scenario or the global figures. So here, if we see the scenario, we can see like the health gap. It is very clear. Like in 2023, near about 260,000 maternal death that occurs all over the globe. And out of that, 92%, as I discussed before, was in the lower or the middle income countries. But that means like near about 712 women, they died every single day. 92% of these deaths 92% of this death. So 92% of these deaths it's 92% of these deaths, as I discussed before, occur in the sub-African region. Now, the very good news that we can see from this slide is like there is a 40% drop in the maternal death since 2000. But what is more important to know is that this death, the progress of definitely the death rate has been reduced, but the progress is stalled. The progress has slowed here. This tells that the progress in maternal death, the reduction in maternal death is not something automatic that will happen. We have to work for it daily. We have to work for it on a continuous basis. 70% of the deaths that occur in Africa alone, but in Central and in Southern Asia, this death can be seen for this Central and Southern Asia, one in every 410 women faces the risk of dying from childbirth. So the not only maternal death and neonatal death is the issue today. The another important inequality reason is the rising burden of non-communicable diseases. So as we all know, the non-communicable diseases are the heart diseases, cancer, diabetes, and all. So what we can see from the statistics available from the sources of WHO that in 2021, the non-communicable diseases they caused about 43 million deaths, and that is near about 75% of all deaths in the world. Now here, if I 75% of the all death in the world, I am not counting here the pandemics and all. Heart diseases only account for near about 19%, 19 million of the death, which has been followed by cancer. So here is the key equity point that 82% of this premature non-communicable diseases that accounts for before age 70 death can happen in low and middle income countries. So non-communicable diseases are no longer just a disease of rich country now. At the same time, there are conditions like tuberculosis, the conditions like HIV and all, malaria. So they also account for the same. They also account for among the poor countries, weak, where the healthcare system is quite weak. The tracking of a health system is weak, and there is a lot of staff shortages. So, what does this mean to nurses? For nurses, it mean like today nurses, we have to be skilled. We need to be skilled in both the chronic diseases as well as in the infection control, in the field of infection control also. So beyond diseases, there are 6 important pressure areas. Like means, if I say that it's not only about the maternal mortality, neonatal mortality, and the non-communicable diseases, the other area that equally, requires our attention are the 6 major areas which you can see on the screen. That is, first is mental health. 1 in 8 people they live with this condition, and where this mental health is also not accessible, not well accessible to everybody, right? And second is this climate change. So the major concerning factor for WHO today is about the climate change. Like this is a major health threat. This is a major health threat. Like sudden worsening of heat, then the excessive rainfall, which results into sudden food scarcity, then disease conditions. So this climate change is also a very issue, is a major issue, which is also resulting into the health inequalities. Migration, displacement of people from one place to the other causes a fragmented care. The continuity of care is disturbed. And the countries where there is a conflict, where majority of the conflict is occurring, those countries are like fragile countries. So here, out of those 37 fragile countries, 60% of the global maternal death is occurring. Aging population, like in majority of the developed countries, the major issue for them is the aging population and the staff shortages. Compounding effect overall, these forces, they just they all when combined together, they actually just multiply the level of health inequality and make more vulnerability. So the WHO health determinants, social determinants of WHO in health, all everybody of us are aware about it. So you all know that what are the determinants of health. But this circle which you can see on the screen, this is what where we come to know that health is uh, definitely it covers various parameters, but the central parameter, that is the people itself, that is individual lifestyle, is not only one factor which is resulting into health inequity. There are surrounding circles which you can see around the circle of people, the surrounding circles here, like the social and community networks, then the outer circle of living and working conditions, and the surrounding outer major area, that is the social, economic, and cultural environmental conditions. So when I talk about socio-economic and cultural environment conditions, definitely if a people individual lifestyle play a role in the health, but around that there are other areas like the family and the community. So living and the working condition of that person. So here is a key idea that the outer circle shape everything inside them. You know, in the outer circle, that is the socio-economic status, then the environmental condition. So this major circle, which is outside, it will definitely affect the individual lifestyle, living and working condition, and the social community. That means the biggest outer circle is the wider economic and social environment. Outer circle, it will shape everything inside an individual. So we simply can't just blame the individual for such conditions. Actually, other 10 determinants, which you can see on the screen, like income and social protection, housing condition, gender norms, geography and rurality, and the status, education and literacy, they also play an important role and act as a determinants of WHO social determinants. Now, the global burden. So here we'll see that uh, how this plays out differently around the world. If you see in the slide, so, so if you see here the global inequality, what can be seen that according to the different region and the country, the nursing implication may vary. It may differ. In a country of high income, a high income country, the major key equity indicator, which is resulting into the health inequality, is the aging population. And also the burnout among the staff, the retirement of the staff, which is again resulting into staff shortage. So for this, what nursing implication can be done? That they should try to retain the staff. For burnout like condition, some time of training programs can be started. The staff can be skill mix trained rather than trained in a particular skill. There can be skills can be different type of skills can be given to the staff. Then in low income countries, definitely the maternal mortality rate, if I compare, in a high income country, it is 10 in 1 lakh birth. But in an low income country, it is 346 in 1 lakh live birth. So what can be the nursing implication in the low economic country? It is to grassroots level preparation. That means the staff should be provided resources. There should be capacity building, should be done at the community and at the primary health center level. In the country like India, where the MMR has definitely, that means if I talk about in 2016, the maternal mortality rate was 130 in 1 lakh live birth, which has definitely reduced to 97 now, as per the 2024 data. But this gap, this decline is not that much significant. Why? Because there are certain rural and urban disparities and gap. They still persist. So what can be done at the rural level? The strength capacity building and training program should be given and to the ASHA workers, ANMs, and the community health officers, those who are actually leading the primary health centers. Similarly, if I talk about the region of sub-Saharan Africa, the 70% of global maternal deaths they occur here, and which has been seen, which has been predicted that in 2030 there will be a 70% of staff shortages or shortfall will be there. So for that, what is important? What has to be done? The be made in the field of nursing education, and the nursing staff should be retained. In the regions of Southeast Asia, there is a high rate of non-communicable diseases and the infectious diseases. So for it, definitely integrated non-communicable disease and communicable diseases, they should be integrated, and those type of nursing models should be initiated so that both the conditions can be taken care of. Now let's talk that about why nurses they matter so much, starting from the numbers. So according to the report, you can see on the source, like according to the report of the State of World Nursing 2025 report, the global nursing workforce or the novel nursing workforce have grew from 27.9 million to in 2018, which was 27.9, or you can say 28 million in 2018, which has been grown to 29.8 in 2023. And it is being expected that in 2030, this may further grow to 36 million. Definitely, the progress is good, but still there is a shortage of 5.8 million nurses worldwide. Still, there is a shortage. And nearly 70% of this shortage will be in the regions like Eastern Mediterranean and African region by 2030. So now the single most important number, what is need to be paid attention is 78% of the world nurses, they live in this country, and that hold only 49% of the work population. That means the world nurses are concentrated in countries, and at home they are just 49% of the global population. So this is the major equity gap in the statistics. So nurses and midwives, they are actually the global health forces. They are the they cover half of the health worker on the planet, and in most of these communities, they are the first, closest, most trusted point of contact with the healthcare. Now, why nurses matter? These are the clear indications that why we nurses are more important. We are being found to be a key agent for reducing the health inequality. Because first is the accessibility. Nurses, they work in the clinic, they work in the villages, they where doctors are scarce, definitely nurses are the first point of contact. So people, because of this, there is a strong community engagement. Nurses, some of the time they are in the community, ANM, ASHA, they live in the same area. So what happens? The community and the local people, they are definitely accessible, and they are more engaged with them. They also enable that cultural, what to say, the cultural similarities between the healthcare, between the nurse and the community. Then they also amplify the patient's advocacy. If I talk about leadership, so majority of the primary health centers, nurses are playing an important role as a leader, because they are shaping, or they are bringing a reform in the healthcare system. People, they trust them, and it is a very great thing if I say that among all the professions, nursing is being found to be the ranked as the most trusted profession globally, where the public trust is definitely more among the nurses as compared to the physicians and all, because nurses, they spend that much time with those community people. And in sense of health promotion, so the first level of prevention before the disease has occurred, by health awareness, by providing health education, nurses, they prevent the disease. So they also act an important part for health promotion, preventing the disease before it has occurred. So now the core slide of this entire session is here. That means what are those strategies, nursing strategies, by which we can reduce this health inequalities. So the 7 most important strategies are on the screen. That is community and primary health care, maternal child health, mental health, evidence-based practice, digital health, telehealth and AI, nursing-led clinic, and policy advocacy. So here the point is, you can't say that all those things will occur, all these strategies we have to adopt one step, then the another step, then the third step. Actually, all this has to work together in a different level wise. That means, when you have to focus on the community health care, and in the community, the various life stages like the maternal, child, school, elderly, all those things has to be taken important care. So we will be discussing about each and every strategy one by one. First is community-based care and primary health care. So in community-based nursing, what it covers, the first major strategy or the group is community and primary healthcare. So community-based nursing means definitely the home visits and the outreach where people, the nurses, they travel to the people where they are living and just trying to reduce the travel and the cost barriers. So this removes the barrier of travel time and also the cost. The primary healthcare that is being led by the nurses, according to WHO, the most cost-effective way to reach a universal health coverage. Health education simply by giving a structured teaching program on nutrition, on hygiene, the health promotion level one, that is the disease prevention, can be achieved by providing the health education to the community. Preventive care by the means of immunization, screening, and you can just and by doing the early intervention. So these inequalities can be downstream, can be reduced. Now, I was talking about the life course nursing that is at different levels. Either it is maternal or child health nursing, school health nursing. So you all know, like under maternal and child health, definitely the skilled antenatal care, postnatal care, like things comes, and postnatal nursing. And, 1 second. Can you see the screen? The screen is visible to you? Hello, ma'am.
Yes, ma'am.
Yes, ma'am. Yes,
So
ma'am.
screen is visible to you? Okay.
Yes,
Yes,
ma'am.
ma'am.
Screen is visible.
Okay. Okay. Thank you. Thank you. Okay. So under the life course nursing, you can see maternal and child health nursing, the various skilled care like antenatal care, postnatal care, conducting a normal delivery. So these are the strongest level of strongest level of care which a nurse can provide in order to reduce the maternal mortality and morbidity. Now, in school health nursing, we know the role of a school health nurse, screening, performing the health assessment of the students, irrespective of their family income, and providing health education related to hygiene and nutrition. So here, this particular role of a nurse that has been played in a school take care of the child health, and in elderly long term care like nurse led geriatric cares are there nowadays. Mobile health services are there. So this provides long term care, and in adolescent health, reproductive and mental health. Other than this, the third strategy is mental health, which I have already said that 1 out of 8 people are actually having this, actually need care from the mental health perspective, but they are not, but this care is not accessible to them. So if I talk about mental health nursing, the screening related to health, routine care like which is sometimes might be visible like if a school health nurse, if she is working in a school, so along with the child's physical health assessment, that the nurse can also have a mental assessment of the child, can come to know that whether the child is facing some type of stress and all, and that can be recognized and timely intervention can be done. Cultural competence, patient-centered care, where the decision making is done along with the where the care is not just simply imposed on the patient. It is being discussed and planned together. And trauma-informed communication, like there are now in the present scenario, there are various such situations that emerges in front of a nurse in a hospital setting or in a community setting, where the patient might have experienced some past trauma, might be experiencing some type of conflict or violence. So this type of communication skills has also been required, that the nurse should be skilled for that also, so that the adequate care can be provided to the patient. Evidence-based practice, as it's very known that it's the nursing care which is been best through provided through the research by clinical practice and all. So for that there are various WHO ICN guidelines. There is an audit system, feedback cycle and all. But what is more important is in evidence-based practice, the important part is health literacy. Now, three simple steps is the for evidence-based practice is the WHO and ICN clinical guidelines. So this WHO and ICM clinical guidelines are actually need based, and they are being adjusted according to the local needs of the community. So it has been regularly audited, reviewed, and so that to check if the care is fair and it's been provided to all the groups. So nurses can create new knowledge, not just by use knowledge from elsewhere. Nurses can also take the knowledge from various type of this research articles which are available on the various sites which have been cited properly, and not just now it's not just about evidence-based practice, but the important role here is on the health literacy also. This means health literacy simply means like how well someone can find, understand, and use health information. If you are providing health information to a particular community, it should be very simple language, which can be simply understand by the community. It will be better if it is being given in their own language. Nowadays, various digital contents are available, which are in multi-language. Even government various portals are there where health awareness, such type of programs are going on and which are multilingual. Now, the teach back verification technique is the best one rather than simply teaching the community people or the patient like you have to do the particular thing like this. After teaching you can ask like, okay, now you tell me how you are going to do it. So that is the better way by which you can achieve a health literacy. Digital health, telehealth, the best example that you might have definitely heard about is ABHA program, the digital health record, like India's ABHA. Are you aware about the ABHA system? Because telehealth nursing, yesterday also one of the speaker was speaking about it. He was discussing about it. So what is ABHA? ABHA is actually Ayushman Bharat Health Account. So this Ayushman Bharat Health Account is the health record where people can have their history, health history from wherever they go for care. Okay, so it is basically an four-digit digital health ID is being made with the help of Aadhaar card or the driving license and all. So wherever they are going for their treatment, so the patient have access to all the health data which can be available if he wants a treatment in one hospital and now he wants the treatment from another hospital. So data can be easily transferred. Even the data is being available with the patient also. So, but here is an important warning that every digital tool must also plan for people who do not have good internet access. So otherwise, what will happen in those areas where there is not having good internet access, the people who need most will be definitely left behind. So about this AI assisted nursing, I hope you people might be aware. AI assisted nursing comes like predictive analysis. So what predictive analysis is? Uh, Before a disease has occurred, okay, depending on the patient's age, patient's lifestyle, patient's work, ठीक है, the type of the type of height, weight, all those data. Okay, we can predict like in coming future, in the next 5 year or 10 year, what are the diseases which the patient can be prone of developing. So this type of AI assisted devices or apps are available on the basis of which we can do predictive analysis. We can give a health record. We can get a complete record of the client. Definitely, digital health records are there, which are, as I have already discussed about ABHA. This is one of the great digital health record available. Uh, Other than that, there are various nurse-led clinic. I see nowadays various researchers, the MSc and the PhD students are carrying out on this nurse-led clinics. But other than that, there are certain global examples I would like to present, like in the countries like UK, Australia, and all. There are in UK there are nurse-led clinics where actually the nurse practitioners they worked independently and they have worked a lot for the reduction in the rate of global health inequalities. So this rural health services are there where we have this mobile health facility, mobile units are there for providing the health services. So now come the final thing that what role the nurses can play when it comes to the terms of policy advocacy. So policy advocacy means like nurses they actively influence the laws and funding decisions so that health equity stays as a top priority. So nursing leaders, like, the nurses who are taking role of chief nursing officer or even government ministers, they are shaping the health priorities at the highest level. The conditions like disaster preparedness, they matter. Because the trained nurses, they save the lives during emergency, especially for the most vulnerable people. Climate resilient healthcare, adjusting nursing care for heat waves, floods, and changing disease patterns. Artificial intelligence, a few things I have already discussed before, but here are certain four ways, like predictive analysis, which can warn nurses early, about the patient's condition. Other than that, there can be remote monitoring. You might have heard about the wireless devices or the sensors. You might have heard about the glucose patches, which continuously monitor the glucose level. Okay, so the smart watch that you are wearing. So all those things are wearable devices which can give the real time data and which are being currently used in many hospitals also. Clinical decision making for which AI is actually helping by supporting the staff. It is not replacing the nurses, but it is actually supporting the nurses to prioritize the care when they are very short, when they are very short staffed or they are very busy, when there's a staff shortage. So clinical decision support can be taken by the AI tools. Other than that, now paper-free works are then under than this AI administrative automation. But everything comes with a cost. So definitely AI also have certain drawbacks. Like the major drawback is algorithm bias, because AI is nothing. It is just a web of data, an entire web, and a lot of data is available with AI. So sometimes what can happen, there can be an algorithm bias. For two clients, it can give a same type of treatment protocol or same type of care, but definitely it's not possible. Every client is different, so their needs will be different, and accordingly the care will vary. Other than that, the another issue with AI is the data privacy protection, which definitely we don't have. Once you give all your data to Chat GPT, or when you so definitely that data is stored. If next time when you are giving any command to AI, so definitely AI will think from the perspective of a Lekha who is a nurse and who is a specialty of OBG, right? But you have told them once, but it keeps the data with it always. So there is no data privacy. The data is available everywhere then. Other than that, there are certain AI must augment, like never replace. That's a very important point. Many of the professionals nowadays are being threatened or are actually are worried, like definitely AI will replace them. But the role of AI is to augment, to support, to increase our work capacity, but not to replace certain. Definitely, but in the coming days, the AI and digital nursing will be playing an important role for the nursing care provision. And in terms of nursing leadership, what nurses leaders can do. So it's not about, like, for nursing leadership, the nurse has to be sitting somewhere in the higher post of a manager or a kind of a superintendent. Then only the nurse is a leader. The teacher, like people like me and you, can work as a nursing leader in the field of education. When we are teaching our student, we can embed this health equity right from the day one by sending the student to the community posting, by telling them that what are the health needs, by guiding them, and then to the hospital setting. So the people who are in the primary health centers, they are also require the same level of care, the equity of care, as I said before, as the person who is working, who might be admitted in a in a corporate hospital. Other than that, in the nurses research, when we guide our students for research, when we do research, so those research can be nurse led, which can build on the local evidences. Various innovations, universal health coverages, and by global governance, this health equity can be accessed. If I talk about the Indian perspective, you all might be aware about the Ayushman Bharat Yojana. So what we call it as the Ayushman Arogya Mandir. So there are near about 1.84 lakhs Ayushman Arogya Mandirs operating across the country, and over near about 10 lakh Asha workers. They deliver this essential and child health care at the last mile. 55 crore of the people are covered under the PMJ Yojana, which provides near about 5 lakh rupees of health insurance per family per year. And our maternal death rate has dropped from 130 to 97 per 1 lakh birth between 2016 to 2024. Now let's look at the nursing contribution behind. But behind all these figures, whatever you see, the decline in the maternal mortality, the 55 crores of these beneficiaries. But the point is, what contribution we have made? We have made contribution by being the community health officers. The students whom you have taught, they might be serving as GNM or BSc. They might be serving in this Ayushman Arogya Mandir as the community health officers. Then our nurses, by enabling or implementing this ABHA ID, so they have strengthened the Ayushman Bharat digital mission. ANM and staff nurses who are providing skilled antenatal care, immunization, and non-communicable disease screening. So that is because of the role of ultimately the nurses, because we are the majority of the healthcare staff are being backed up by the nurses. So it's all our contribution that you can see these big figures in front on the screen. So other than India, there are certain best practices that are being mentioned in the countries like Finland, Australia, and UK, where there are this nurse-led clinic. The nurses are working as a rural nurse practitioners. They are working in UK. They are working as a nurse-led clinic, which have expand which have actually reduced over the doctors and which have actually reduced the minor illness or the long-term conditions. In Ravada, you can see the major development where the maternal mortality has been gradually reduced, because here now they have also established community health officers or community health workers, where all this type of maternal mortality antenatal care are being provided by the nurses. So what all strategies I have best discussed about all the 7 strategies. All those 7 strategies have been taken from all these sources. So these sources include the State of the World's Nursing 2025 report. It also include Lancet Global Health, the WHO, UNICEF, and World Bank report, and National Family Planning Survey 6. I would like to tell that the strategies have been taken from all these sources, and many such conditions where the further research can be done are being recommended by these sources. But still, we know the solution, but there are various challenges because of which it's quite still tough to acquire the complete health equity. That is one of the foremost important challenges is the shortage. Still, we are 5.8 million shortage of the staff can be seen. Burnout, definitely we are working more, paid less, which is worsening the situation again. Then there are certain cultural barriers, because yes, in India there are still certain cares which are gender based. Definitely the gender norms and stigma are being attached to it. There are funding constraints. Then still many of the people, even the staff nurses or the nurses also, I will say, they are not trained digitally. Many of us might not know how to use an AI software or an AI app, or there are certain misinformation which is available. So because of which the challenges, these are the major challenges because of which it's difficult to attain the equity for health equity for each and everybody. So for the future directions, definitely we have to make like public health means targeting help, means exactly where it is needed most. So it's not like you have to organize a camp, but yeah, you have to organize a health camp, but that health camp should definitely be having the objective of by identifying the need of that particular community, that what type of diseases are prevailing, what type of health needs are there for that particular community area. According to that, the health camp or health services should be provided. So AI augmented nursing means well-managed technology to help nurses to do more without ever replacing their human judgment and care. I again say that AI is there to augment the nursing work. AI is never there to replace the judgment what a nurse has made. Then there should be measures to enhance the global collaboration. The country should work together so that nurses can move for better opportunity without draining nurses from one country to from countries that need them. And building strong nursing leadership pipelines are important. So certain key takeaways of the session is like health inequality, as I said, it is avoidable and unfair. We have discussed that the data which is being related to maternal health, child health, and NCDs, but also important crucial fact about the mental health burdens. The social determinants are definitely education, geography, and digital access, but also clinical care, and clinical care only can't fix all those issues. Nurses are the most trusted one because we have seen they are quite accessible. They are the part of the community. They are having the uh, trusted and most accessible. And we have also discussed about the 7 strategies that can result into the decrease in the health inequalities. So overall, I would like to end the session that by saying a simple quote that nurses are not only caregivers, they are leaders, advocates, innovators, educators, and catalysts for achieving health equity worldwide. So as such, what all health strategies we have discussed, those health strategies are nothing new. It's been already embedded in the curriculum. It has already been done in each and every, but about AI and the digital or health informatics or digital information or digital data. Thank you so much for your patience listening. The various sources and references already I have discussed, and these are the few. I would like to again thank the foundation for giving me this opportunity to present this session, to take this session, and thank you so much.
Thank you, ma'am. Yes, ma'am. Thank you, Lekha ma'am, for this wonderful session. So we will move on to the next speaker, and the next speaker is Dr. Lata Venkateshan, ma'am. She is a principal. Ma'am, are you available? Lata Venkateshan, ma'am. She is a
Yeah,
principal in
available.
College of Nursing, AIMS, New Delhi. It's over to you, ma'am.
Yeah, thank you. So, thank you so much, organizers, for inviting me to speak on health education and health promotion. I think my previous speaker also was addressing so many aspects of health education and health promotion, how it is promoted, the health indicators in India. Are my slides are visible?
Yes, ma'am.
Yeah. So I'm asked to speak about health education and health promotion. So when we utilize these strategies, how we can move from treatment approach to transformation approach. That is what I'm going to speak today. And advancing global health through health education and promotion strategies will definitely help in building equitable, inclusive, and sustainable healthcare for all. Healthcare addresses only tip of the iceberg because only the patients coming to the hospital are being treated or educated or oriented about how to prevent the complications. And we are also concentrating on the healthcare infrastructure, how it will be preventing infections, how it will be promoting the wellness. So only tip of the iceberg of the problem is being addressed currently. Whereas if you see, the problems are arising from their lifestyle, and 80 percentage of the problems are behavioral. It is related to the social environment and the economic factors. So this 80 percentage of the factors are still not addressed until it emerges and comes to the clinical care. So this 80 percentage of the foundational health aspects, how it can be concentrated, how it can be uh, strengthened, is definitely through health education and health promotion, so that we will be able to prevent the diseases, we will be able to prevent complications, advancements, and so much, and so we will be able to promise better quality of life to the population. So the true population health is determined before the patient comes to the hospital. So improving health outcomes require concentration of this 80% of the factors at the community level. And India is facing a battle between traditional diseases and modern diseases. The traditional diseases were caused by the pathogens, like tuberculosis, malaria, diarrheal diseases, maternal deaths. All these were caused due to the pathogens, and some are vector-borne diseases. And the drivers of these diseases were due to resource scarcity, sanitation issues, and the transmission of pathogens. And the primary need was focused on clinical interventions and improving the sanitary conditions. So this was one segment where India is tackling the traditional diseases. At the same time, now there is an increased percentage of modern diseases, the diseases which are caused due to lifestyle, like diabetes, hypertension, obesity, stroke, cancer, depression. All these are the modern diseases due to lifestyle factors. And the drivers are because of the environment, because of the behavior and lifestyle changes. And the primary need here is bringing the behavioral change and promoting the health. So, this is where the topic also rightly aligns. You require health education as well as health promotion. So, health education is for preventing the traditional diseases, and health promotion is for preventing the modern diseases. So, we have to draw a line between these two, and we also have to devise the strategies to tackle the traditional diseases as well as modern diseases. So, this double burden transition demands a fundamental shift from the treatment oriented care to prevention and health promotion. And India has already improved its health indices. Recently, the National Family Health Survey report was published, in which we are far ahead of achieving the SDG goals, and many of the indicators are very promising and moving forward. Like once upon a time, we had high maternal and infant mortality rate, low immunization rate, poor sanitation, low literacy rate, and high fertility rate. But now, if you look at the maternal infant mortality rate is also grossly reduced. Immunization rate has increased up to 98.4%. Literacy rate has increased up to 80.9%. And fertility rate has reduced to 2, and institutional deliveries are promoted to 88.6%. Contraceptive use also has increased from 40 to 56.5%. But is sufficient? No. We are facing the ongoing challenge of anemia, childhood stunting, diabetes, mental health, air pollution, and all these requires sustained health education and health promotion activities. Still, we have the challenges which are ahead of us, which requires structured health education and health promotion. And of course, India has already proven, if you take some case studies, this case studies shows that how health education and health has prevented the diseases, and how certain significant achievements were made. Let us look into these case studies. The polio eradication, India accounted for half of the global cases in the early 2000. But if you look at now in 2014, India was declared as polio-free country. How it was possible over a period of 14 years to eradicate polio from India? It was through door-to-door campaigns, through the ASHA workers, and through religious leaders' engagement, and through celebrity advocacy, and Mission Indradhanush. Multiple other programs has helped to eradicate the polio. So how did it happen? It is mainly because of health education. So this is a one important case study we can take up, how polio was eradicated by promoting the awareness through health education. And yet another significant case study which normally everyone presents is this Beti Bachao Beti Padhao program. This was started in Haryana, in Haryana, if you look at in 2012, if you look at their female to male ratio was uh, 830 to 1000. No, they had 830 women, females, whereas 1000 males were there. So this imbalance was noticed, gender imbalance. This was mainly because of female infanticide, this program was launched in the year 2015, and to combat the gender discrimination through awareness, and not just only giving financial incentives. They had multi-pronged strategy, and even they were going and seeing a MTP Act was very strictly enacted, and the nurses and ASHA workers played a very significant role here. They were monitoring the clinics where the MTPs were happening, illegal MTPs were stopped, and PCPNDT Act was very strictly enacted. Sex determination was banned and it was monitored. And to that extent, they also monitored the IVF centers. In IVF centers, if sex children are born more, if male children are more, then more scrutiny was taken up. Who all had this male children? Did they had already one girl child and went for a male child, or first itself was a male child? For each center, how they were performing, how many, whether the sex determination was happening in IV centers, is the balance is there, gender balance is there. This kind of scrutinizing happened in Haryana. So all these multi-pronged strategies helped them to impact the sex ratio. It has improved to 918. From 830, it improved to 918. And then it also improved to 929 in 24-25. And secondary education girls' enrollment also raised from 75.5% to 80.2%. So this Beti Bachao, Beti Padhao program, you would have seen that behind every bus, every auto, everywhere this program was popularized very much. So that has helped them to improve the sex ratio in Haryana. So this is also a typical case study we can take. What are all the strategies they have used? How did they reach out to the population? How did they raise the awareness so that they are able to improve the sex ratio in one particular state, and other states also can replicate and take the best practices from this model. And Anemia Mukt Bharat program also, they have this 666 strategy. Now recently it is revised as 777 strategy. That is nothing but 7 beneficiaries, 7 interventions, and 7 institutional mechanisms. So they have had this approach. In this approach also, if you see, mainly the health education was taken as part of the intervention to promote iron and folic acid, weekly once iron and folic acid supplementation, deworming the children, behavior change communication was the main one, and then testing and treatment, delayed cord camping, fortification. So these things was eating right is added as a 7th component now. And similarly, institutional mechanisms, all these helped in improving the hemoglobin levels and reducing the anemia. So here, if you see how did it happen, it was because of the health education and compliance to the iron and folic acid intake. So all these successful program, if you look at any of the community health program which has remained successful and shown good indicators, it is mainly because of the health education. And there are also global evidences are there. The global evidences are also confirming that the policy combined with the education is changing the population. If you take Finland, this is a very famous project. I think many of you might have read also. It is known as North Karelia project. North Karelia is a place in Finland. They were having very high cardiovascular mortality comparing with the worldwide statistics. Finland was having the highest cardiovascular mortality. And then in 1972, they started this project. It was the first public health interventional project for prevention of non-communicable diseases. It was started in the year 1972, and in 1972 they have started, and they within over a period of time, now they have reduced 80% of non-communicable diseases in Finland, and they have reduced the cardiovascular mortality resulting due to NCD. So how did it? They have increased the life expectancy also. So how did this happen? How they were able to achieve this outcome is through community education, healthy food policies, through salt reduction and media campaigns. They were able to achieve this. Well, once highest mortality happening from cardiovascular diseases, now they have reduced 80% of mortality resulting from cardiovascular diseases. So these are all the strategies. In this, if you see, mainly the community education has played a vital role. So this is how Finland has proven, and this is the first NCD prevention public health program started in 1972. Similarly, if you look at Thailand, Thailand has got a strategy, innovative funding through tobacco taxation. You know, the tobacco, when they buy a smaller pack, the taxes are less. When they buy a bigger pack with more cigarettes, the taxes are more. You know, so when they increase the taxes, they also aimed at that the people may not take many, and then they also had a check on when you are increasing the tax on tobacco products, they might then there are chances for illegal trafficking of the tobacco products. So they were also having a check on preventing the illegal trafficking of the tobacco products. So all these approaches has helped them to reduce the smoking, increase the physical activity, improve the road safety because they may smoke and drive, and then deep community ownership and sustainable financing through for health promotion. So these are all the strategies they have adopted, and that is also proven to be reducing the tobacco consumption among the population and the associated illnesses. You know, tobacco is the cause for hypertension, for lung diseases, for cancer, and whatnot. So when they have taken this strategy to reduce the tobacco-related mortality and morbidity. And you know, if we have to change the bring the behavioral change, only health education is not helpful. You know, it requires the initiatives targeting at individual level, at the community level, and also at government level. Only if the individual is motivated and the individual is supported by the community and the institutional facilities and by the government, then only the behavioral change will happen. And once the behavioral change is there, population health will be promoted and the transformation will take place. So here, if you see, targeted health education is how we are targeting the health education to the individuals. You know, Poshan Abhiyan, which promotes the maternal nutrition and the nutrition among the children and promotes breastfeeding. This is also through one-to-one counseling, one-to-one education. This Poshan Abhiyan makes sure that the maternal nutrition is improved and the nutrition in childhood is improved. That is also happening through health education. And also they also had the Swachh Bharat hygiene education, nutrition demos. So many activities took place. You know, these are all examples of how individualized health education is required to the targeted population. At the same time, the community also has to help. How the community engagement has remained successful. You know, Kerala COVID warriors. You all might have heard about it. This was called as the faceless army. You know, so COVID warriors, the public were invited to act as COVID warriors, and they were helping in tracing the COVID patients and preventing. So this Kerala model is taken as an example how public could be engaged in the health promotional activities or prevention activities. So that was a typical example which has been quoted, how to engage the community. And there are also studies which have shown that whenever you have involved local leaders, those projects have successful and brought better outcomes. So involving the local leaders is one of the main strategy which needs to be adopted when we want to go for health education and health promotion. Similarly, this polio also door-to-door campaigns, that was through community engagement. India was able to eradicate polio through community engagement. So engaging the community, engaging the community in the sense we can also engage the uh, multiple sectors in the community, like the banking sector, judicial sector, schools, NGOs. So we can have the multi stakeholders engagement in promoting the health education and health promotion. And we also need to have cross sector policy. Cross sector policy is, how to work together to bring benefits by various ministries. For example, if you want to implement this Anemia Mukta Bharat program in the schools, where weekly iron and folic acid tablets are given to the children, you require the support of Ministry of Education, because the schools are under Ministry of Education, and Anemia Mukta Bharat program is under the Ministry of Health and Family Welfare. So the convergence of multi ministries are required, so that we will be able to bring the changes. Whereas that way India has proven in this Beti Bachao Beti Padhao program, multiple ministries were involved. You know which are all the ministries are? Mainly the Ministry of Health and Family Welfare and Ministry of Women and Child Development, and they also involved the district magistrates and district collectors. How they were interfacing or integrating the various ministries, so that the benefit is reaching to the population. And such kind of multi-pronged strategies are required. Not only functioning in isolation. Every school is supposed to have a school health nurse. That is there in the CBSE regulations. But then if you look at India, how many schools are having a dedicated nurse? Many schools do not have a nurse. If there is a nurse posted in school health, what will happen? They will be able to educate them, educate the parents, educate the teachers. They will be able to screen for the diseases at a early stage, and they will be able to promote nutrition, lifestyle changes. And at the school level, if the children are being monitored for their health, and if they are inculcated healthy habits, if they are supported, naturally they will be able to develop as healthy adults, and many illnesses can be prevented. So, but this requires Ministry of Education needs to appoint the nurses, no? And Ministry of Health has to support with the policies, protocols, the supplies, resources, referral facilities. All those has to come from the Ministry of Health and Family Welfare. So such kind of unified approaches are required in multiple other areas. Now we also require the support of the technology. So we have to bring the Ministry of Information Technology also to help us how to use the digital technology for health education and health promotion. So like this, the cross-sector policies have to work out. And of course, we have seen already the examples of Thailand and Finland, how they were working. They also used this cross-sector policies where multiple ministries work together with a common objective, for achieving the health promotion objectives and prevention of diseases. So these are all some of the approaches which are required to reach out to the individuals with targeted health education, engage the community so that there is a better reach within the community. And also ministries have to work in a converged manner, so that they can mobilize the resources in a better manner. So this kind of approaches will be definitely helping in functioning together and functioning better. So these are the three pillars of architecture which can bring success in implementing health education and health promotion strategies in India. And out of all these approaches, behavior change communication is the most important one, and it has created an exponential activation curve. If you look between the health outcome and the time and effort taken, the community mobilization, when it is introduced, there will be improvement. So this immunization program, how we have reached 98 point percent, 98.4% immunization coverages through community mobilization. So if you look at the Haryana immunization trial, they took a massive randomized trial, and it has proven that combining the community information hubs with the SMS reminders, and uh, which has improved the immunization uptake. So 44% improvement was shown through this Haryana immunization trial. And uh, they also have included the PHCs. 140 PHCs were involved, and non-cash incentives were introduced. SMS messages were sent. Local social networking was done. So through all these measures, Haryana has shown 44% significant increase in the coverage of vaccination in their state. So these are all some of the case studies we have to take and read, and find out how did they achieve this kind of differences, these kind of improvements. So we have to take this for learning purposes. And also Goa had health promoting schools. They laid health counselors implementing WHO life skill frameworks, and that also has drastically improved the emotional health cost effectively. Again, the health counselors, they were concentrating on the mental health, but physical health also has to be concentrated. So if nurses are there in the schools, they will be able to concentrate on both physical health as well as the mental health, and they can concentrate upon the students as well as their families, because through students, through children, we can send messages to the families, and it will reach out very quickly, and behavioral change can be brought. And PHC innovations also. A study is published by analyzing 12 PHC models, which had proven to be successful. I think someone's mic is.
It's a
Please
humble
invite them.
request to all the participants to mute yourself, please. Prerna Rahul, ma'am, just mute yourself. You can continue, ma'am.
Yes. So, innovations from PHCs are published. Not only Indian PHC models, other countries also, they have adopted some significant PHC models, which are proven to be very successful. It is difficult to mention due to short of time all the public health models, but a few models are from India. It has proven to be very successful. One was this accountable care reforms, under this accountable care reforms model, they have integrated the electronic health records, digital health, and telemedicine and tele health education. So this model has proven to be very successful, and if you read the model, it shows that how the technology being used for promoting health education and promoting health through the electronic health records, big data was available. So from the big data, you will be able to deliver community specific interventions, which community requires what kind of interventions. So, and now, they are using this word precision medicine. In precision medicine also, they are studying the genomics of a population, and interventions are targeted based on the genomics of the population or genomics of the individuals. So such kind of initiatives are also being taken through accountable healthcare reforms. And just a second. Yeah. So then, there was also another program which was introduced in India, which is known as Atmiyata. In the Atmiyata, volunteers were selected and they were trained for promoting mental health among the community. So, they were trained in psychosocial interventions, and this program also had proven to be successful at PHC level. And there are multiple models which are being adopted by the PHCs, and which is proven to be successful both in India and in other countries. So such models also we have to take up to understand what are all the approaches they have used for health education and health promotion, and which was successful, and what kind of changes they have brought in, what are the resources required, what is the cost involved. These kind of analysis will be really helpful for us to really bring out newer strategies in our primary health care. And it requires a life course approach whenever you want to implement something. It is not that at one stage of life they come to the hospital and then we start teaching them on prevention of illnesses or promotion. By the time they have already acquired the disease. So there should be a life course approach which needs to be adopted. Now everywhere they are giving importance to the life course approach. So all our strategies have to start much ahead of time. We can take up the examples from here. We can have girl children, the girl child Beti Bachao Beti Padhao program, where you are bringing the gender equality, school enrollment, and correcting the anemia among the school children, promoting the nutritional status of the girl children and children, especially through Poshan Abhiyan programs. So all these are early interventions. It is a life course approach where the interventions are starting at a early age, and strengthening school health through school health nurses, having school health counselors, involving the parents into managing the health of their own children and the family and their own personal health. These initiatives have to start from the early age onwards. Then, for the infants, once the girl child is born, first of all the child has to be born, then only their health will be promoted. So this sex determination and promoting gender equality, preventing sex determination, all those are helpful in bringing gender equality in the community. Then once the infants are born, they should be protected from illnesses. So having universal immunization program and promoting immunization to a greater extent. I think soon we'll be reaching 100%. So through the programs called as Mission Indradhanush for polio eradication, all these will be reducing the mortality. So the children are born healthy, and then the mortality happening due to diseases are prevented through vaccination. And then what happens when they reach the adolescent age? Their health is again taken care of. Anemia Mukt Bharat concentrate on prevention of anemia, not only among the girls, among the boys also. So in the school, they are taught the life skills, nutrition, hygiene. So that happens to the adolescent population. And once they become the reproductive age group, then the portion of beyond concentrates on maternal nutrition, breastfeeding practices. Then the adults are also looked after in the Ayushman Bharat Health and Wellness Centers. Of course, health and wellness centers also concentrate on all these, but mainly NCD screening and taking care of them for non-communicable diseases happening in the health and wellness centers. So like this, there is a life course approach. We can also include geriatrics here. In geriatric immunization is promoted with the vaccinating against the flu, pneumococcal diseases through vaccination. All these are getting promoted. Recently the HPV vaccination is included in the national national immunization program. So it will be available now for everyone to take up through the national immunization program. Otherwise it was a paid vaccine before. These kind of improvements are also happening. So it requires a multi-sectoral, multi-pronged approach to bring the behavioral change in the community and promote their health. Yes, and the future of health promotion is going to be definitely relying on digital resilience. Artificial intelligence is now is helping every field. So how it can help in the healthcare is, as I told you, through precision medicine. Precision medicine is it analyzes the genomics of a particular population, and then it suggests the initiative based on the population parameters. So you are not having the like one approach for all the population. So based on the geographical location, resources available, the genomic pattern, the disease pattern, how it is manifested in different locations, the precision medicine helps us to educate them based on the parameters which are applicable to them. So that is called as precision public health. So this precision public health is also very, very important, and that way it will be helpful for us to provide a more focused, precise care to the population based on their genomics and other factors influencing. So for this, artificial intelligence will be really helpful because the data is there available with us. So big data are available now, through digitalization. All the patient data is available, and through the data they are doing the data visualization, data mining, and data visualization is done. And through this data they are able to bring out the patterns, bring out the connections, the linkages, and then artificial intelligence is able to suggest better models of promoting the health. So that is going to influence very much, and we also have to understand, or every population is using, now the reports are there. The other day, someone got the ECG. Immediately the picture was uploaded in chat gpt, and chat gpt was giving the complete findings about the ECG. So the patients and their family members are now relying upon artificial intelligence. The moment a laboratory report is there, the moment they have some signs and symptoms, they just type the signs and symptoms and ask, oh, what is this? So it may increase their anxiety also. Sometimes they may have mild abdominal pain. You type as mild abdominal pain, I'm having mild abdominal pain, what will be the cause? It will give all the potential causes, including carcinoma. But there may be simple gastritis or something. So, it may increase unnecessary tension also. It may give misleading diagnosis, but then still people are using it. We have to take cognizance that people are using artificial intelligence. So in our health education and health promotion also, we have to see how to use the artificial intelligence to educate the public, and then digital health literacy also. Patients have to be navigated how to use the health. There are a lot of mobile apps are there available. For example, for pregnant women, there is a mobile app by government, and once they enroll, no, it has got all the health education materials in the mobile app, and they will be able to read the mobile app, and it also, now artificial intelligence also getting integrated into the mobile apps. So it will show based on their condition which content they have to read in depth, which area they have to prepare themselves, like that. The mobile health also is coming up in a big way. Apps are developed, and the apps will track their behavior, their physical activity, medication adherence. It will give them the educational aspects, in a presentable, understandable manner. And telehealth is also happening. The moment there is an abnormal parameter, immediately the treating physician will get the alert. For example, the home health monitoring of fetal heart rate is being implemented, and it is implemented in Andhra Pradesh in few primary health centers, and the doctors will get the pop-ups and alerts to show whenever there is a deviation in their fetal heart rate. So this kind of changes are coming up. So the through digital health literacy, and through counseling how to use these digital apps also will be really helpful in promoting the health education and health promotion. At the same time, we also have to combat the misinformation, because the moment you use the YouTube, I did a study which digital solutions the pregnant women are using more. So if you see, the pregnant women are using, they are not using the mobile app, they are not using the web or internet, they are using the YouTube. And YouTube, everybody is giving the advice, but they are not curated information, they are not validated. Even to YouTube, there are several requests are given now. You please endorse the content, this content is from the professionals, this is reliable. Otherwise, you see, they give lot of advices. If you are pregnant, you take this food, that food, you sleep like this, you lie down like this. And so many people are giving advices, even for other disease conditions also. So many are giving the YouTube videos based on their personal experience, but it will be an individual experience which cannot be generalized. So people are now watching YouTube and other social media like Instagram and things like that. So we also have to use these channels for educating them properly. Like we have to say some kind of validation, this content is validated, it is reliable, you can use it. Otherwise, we are not drawing a line between unqualified people giving advices and qualified people giving advices in this social media. So there are chances that the patients are misled, miscommunicated, and they may practice something. We have seen that somebody has conducted cesarean section looking into the YouTube video, so that's, and the patient died. These kind of things are happening. So we also have to be creating awareness among the public that always do not rely completely upon what is available in the digital media. You need to confirm which one is correct, and then they must practice. So these kind of things are also we have to keep in mind. And climate resilient promotion also is one of the area. Climate, it is becoming warm day by day. And then how people are going to combat with this climate, especially if you take pregnant women. Imagine when there is extreme heat, there will be dehydration. But because of this, what is the impact on the unborn child, the fetus? So these kind of studies also we have to see, because of the climate, how patients are adjusting, and how we can have climate resilient promotional activities. Similarly, during winter also, if very cold is also affecting the people, very hot climates are also affecting the people. So we have to educate them how to protect themselves in this adverse climatic situations. So that is also one of the area which the health education and health promotion need to concentrate. So the nurses, their influence is not confined to the work area where they are working. It is not limited to the ward where they are working or unit they are working. It is not limited to the hospital they are working. They have a widespread role. You may be thinking that, okay, then nurses in the community. Every patient who is coming to the hospital is going back to the community. So in the hospital itself, this kind of community health nursing activities have to be started. Now, they are also saying that patients have to be followed up after discharge also at their houses. Domiciliary visits are being now expected, and many hospitals have started this domiciliary visits. Of course, every patient does not require visit to their home, but those who are chronically ill, those who have underwent major surgery like heart transplant, lung transplant, so these kind of patients require a follow-up care in their house. You cannot be keeping until the patient recovers, then it will take a very long time. Stroke patients also, they are discharged on the 8th or 9th day. But are they recovered on the 8th or 9th day? No, they are only stabilized. For where recovery, rehabilitation is required, physiotherapy is required, prevention of complications such as aspiration and pressure sore is required. Many patients, after going home, the stroke patients are dying because of aspiration, and there are no caregivers for them. These kind of studies also has to be done, and nurses can definitely act as a liaison in all these sectors. So the orbit one of the nurses function, it starts driving direct counseling and behavioral change for health, for the prevention of diseases and promotion of wellness. And then they can also educate the family members also come to the hospital when they are admitted. So or in part of community health nursing also, Strengthening the family, educating the family is also very important, because once the caregiver is educated, once you promote the caregiver competencies, then they will be able to take care of the patients and reduce the mortality and morbidity. So every hospital should have a discharge education program. Before a patient is getting discharged, an education session they have to attend. The other day I went for having a vaccination in a clinic, in a government clinic. So they made 10 or 15 people to join together, and before giving the vaccination they were educating, what is this vaccine, what for it is given, and how it has been prepared, how it will interact if you have allergies, and if you are having comorbid illness. Everything was in detail, very nicely explained, and they have checked after that the vaccine was given. And post vaccine also, half an hour they made us to wait and monitor, for the reactions. And they were educating, if you are traveling, what precautions to be taken. So this kind of approach is happening in the hospitals. When such approaches are happening, it will be really very helpful for the people to know. But I don't know how the discharge preparation takes place in many hospitals. Many hospitals, the patients are suddenly discharged. A preterm newborn, once the slightly improved or better, then the preterm newborn will be discharged. But the mother, was she educated how to prevent hypothermia, how to feed the newborn, when to seek urgent care? This kind of education has to take place. One of our student has done. Uh, how much time I have? Should I finish? I think this is my last slide. I'll finish. So this is how, the patient and family has to be engaged in discharge planning, and discharge education has to take place. So health education, health promotion means it is not only related to community health, and it is the duty of community health nurses. Every patient comes from the community and goes back to the community. So health education and health promotion has to be done in the hospital settings also. Let it be secondary or tertiary care hospitals. There also it has to happen. And then enforcing quality improvement and patient safety protocols, then enforcing quality improvement screening and local advocacy, informing public health programs and national strategies from frontline data, and also for implementing the various public health program. The nurses role of the nurses radiates, not only limited to one particular setting, but to the entire community. The presence of nurses can bring difference, and they can radiate into the community level. So the takeaway is, the nurses influence is not confined only to the clinic, it radiates outward, uh, across the entire policy landscape. So education is the ultimate clinical intervention. Medicines treat diseases, but health education transforms the lives. So we have to move from treatment to transformation. Health promotion creates conditions in which people can live healthier, longer, and more equitable lives. And nurses are not only caregivers, they are educators, they are advocates, they are innovators and leaders in achieving and evolving universal health coverage and sustainable development goals. So, thank you very much for the opportunity given.
Thank you, Lata ma'am, for this wonderful presentation and providing such good information and valuable information to all the participants and to us also, ma'am.
Thank you.
So we will move on to the next participant, the next speaker, and the next speaker is Dr. Sri Lekha Rajesh, ma'am.
Any question from the audience, Manisha? Just give some time, whether they'll post any
Definitely, ma'am.
questions in the chat box.
Definitely.
Or
Sure.
few minutes.
If anyone willing to ask any question, they can ask, ma'am.
Yes. I think in the beginning of the session itself, you can inform, they can post their questions in the chat box, so we'll be able to address. Yeah. Okay. Thank you. I think I am seeing only thanks messages in the chat box. Thank you all, everyone. Hope the information was helpful to all of you. Thank you.
So we will move on to the next speaker, and the next speaker is Dr. Srilekha Rajesh, ma'am. She is a professor cum vice principal, GMFS, TEMI Grant Institute of Nursing Education, Pune. Srilekha Rajesh, ma'am. Ma'am, are you available? Srilekha, ma'am.
Good morning to one and all present over here. So, first of all, I want to thank the GIAR Foundation for giving me the opportunity to serve as a resource person in the international conference. And I really appreciate the efforts of the foundation for choosing the apt topic, which is global health inequalities and nursing strategies. So thank you once again from the bottom of my heart. I hope I will do my best. So, I'm very happy to see that almost majority of the participants, they are there in the conference room, and it will be good if the participants, they also switch on their cameras, because otherwise it is looking like as a one-way communication. So if we have to have the interactive session, or if the questions in between, so the members or the participants who can switch on their videos, I request them to please switch on the video so that we can have a conversation in between. So thank you all. So going ahead with the next topic that is assigned to me, just I want to give a flashback of the previous topics which we have already discussed. So in this 2 days of a virtual conference, the major topics that were discussed previously are the recommendations for improving the global health, sustainable development goals, about the health inequalities, what are the different health care inequalities. And in today's session only, Dr. Lekha madam has discussed about the nursing strategies, how, what are the nursing strategies to overcome the health inequalities. And in my previous session, the session conducted by Dr. Lata Venkatesan ma'am regarding the health education and promotion, it was also out of her experience. Madam has discussed many things related to all the different aspects, and madam has also mentioned about the technology, digital health, telenursing. So in continuation with the previous topics, I want to tell that the topic assigned for me is use of technology and telehealth care in nursing. So I want to request all the participants, if they are having any kind of queries, or if they are having any kind of problems, they can write down in the chat box so that we can have the sorting out at the instance only. So I think the setting is changed. The screen is visible or not visible now? Slide is visible, ma'am. Please, can anybody tell me? The slide is visible?
Yes, ma'am. Slide is visible.
Yes, ma'am.
Yes, ma'am. Just hold on for a minute, please. There's some technical glitch. Just 1 minute. Now the slides are moving. So now I went to the second slide. Please, can anybody inform me?
Yes, ma'am, it's visible.
Okay. Thank you, Durga ma'am. Thank you so much. Okay, so this is the university. I want to give an overview regarding the university in which I am working in. It is Gopal Narayan Singh University, which is located in Bihar. And we have many departments in our university, including the medical college, nursing college, management, pharmacy, agriculture, law. So it is one of the leading private institutes of Bihar. So this is the Narayan Nursing College, which is coming under the Faculty of Nursing under Gopal Narayan Singh University in Bihar. So when we move on to the presentation outline, what all topics we are going to discuss in today's session. So I will discuss about the introduction to telehealthcare in nursing, as the topic assigned to me is the use of technology and telehealthcare in nursing. So the topics which we are going to deal today are the introduction to telehealthcare nursing, what are the effects of technologies on the nursing practice, the care delivery models and modalities in healthcare, what are the advantages and disadvantages of telehealthcare, the different research topics that we are going to have in telehealthcare nursing, what are the emerging technologies which can help the nurses and which can help in strengthening the healthcare system, then telemedicine and telenursing apps, along with the various research studies that are being conducted on the telehealthcare nursing. So next I'll move on to the topic. So in the recent years, the landscape of healthcare has undergone a transformative shift, which you all can see with the integration of technology with various aspects of patient care. So now we are very much thinking about the technology for ourselves. We are using technology. We cannot live without technology. Anybody of you can live without phone? No. Anybody of you can live without internet? So it has become an integral part. The technology has become the integral part of our day-to-day activities. So one of the significant advancements in the realm is the implementation of telehealth and remote patient monitoring, which may be a new topic for you all. You might have heard theoretically that this is there, that is there, these programs are going on. So as we are a developing country, much of the initiatives are taken by the authorities in relation to the telehealth care, but still we have to do a long way. These innovative approaches, they have ushered in a new era of patient care, enabling healthcare providers to deliver services beyond the confines of traditional brick and mortar facilities, the hospital facilities. So technology is transforming India. Technology is rapidly transforming nursing in India, shifting the profession from manual paper-based routines to digital data-driven healthcare. So it is drastically improving the patient care, clinical decision-making, administrative efficiency, and continuous skill development across the country. And it is also, technology is revolutionizing the global healthcare by shifting the focus from reactive hospital-centric treatments to proactive personalized care. So as you all know, nowadays, everybody is aware of the technology. So instead of having only the hospital-centric treatments, a proactive approach in personalized care is advancing nowadays with the help of telehealthcare in nursing. So you might have heard of all these things, the innovations like AI diagnostics, which were discussed in the previous sessions also by the eminent speakers, the telemedicine, wearable devices, they are all drastically improving the access, reducing the operational costs, and empowering the patients to actively manage their wellness from anywhere in the world. So what is telehealthcare in nursing? So the telehealth care in nursing it uses, as per the global scenario of healthcare industry, the article published in December 27, 2019, telehealth in nursing or telenursing, it utilizes the digital communication technologies like video conferencing, remote monitoring, and secure messaging to deliver remote patient care. It enables nurses to track symptoms, manage the chronic diseases, and coordinate the care across all geographical distances, which ultimately improves the healthcare accessibility and efficiency. So telehealth nursing, majority of us would have come to know about the telehealthcare nursing during the pandemic COVID-19. So I hope everybody is aware of this. So when we talk about the nurses in relation to health, so nurse, so what all things should be there in the nurses when they have to equip themselves to work as the digital nurses, to work as AI nurses, to work as a part of telehealthcare nurse team. So when we talk about N, here is the navigating the artificial intelligence basics. So nurses, they should promote the basic understanding of AI among themselves as a leadership responsibility. So when we are not knowing about the various aspects of AI, so we will not be able to work properly in the setting which has AI usage. Then next is utilize the AI strategically. So majority of the people, they have the AI apps or they have the things with them, but utilization is also one of the aspect. So utilizing it strategically, recognizing the pitfalls, it leads to the efforts to balance innovation with risks. There can be bias in the technology. So, sorry, there can be bias in the technology. There can be, we should not have the over reliance with the technology, and sometimes misleading data, misleading information is there, inaccuracy is there. All the nurses, they should be equipped with the AI knowledge in which they recognize what are the pitfalls in AI. Skill support, AI helps us in improving our skills. So it helps in upskilling and professional development to prepare the nurses with AI integrated curriculum. Then ethics in action, it guides ethical AI use in running by promoting transparency, fairness, and accountability. How to use AI, how we have to maintain the ethical boundaries in using AI. And ultimately, these all measures will shape the future of nursing. So direct AI implementation should be done in ways that align with the nursing values and improve the care quality. So when we talk about, I request, I think somebody is doing something on the screen. Kindly please avoid all the participants. So next are the effects of new technology on nursing practice. So as we are discussing about the AI and telehealth and technology, so you all know that if technology has got lot of effects, I can say the positive effects on the nursing practice. So all the advances which are there in the medical technology, when we are going to the hospital, we can compare 10 years before when we were going to hospital, what were the things which we were observing, and nowadays what all are the advances in the hospitals, in the healthcare, uh, for the healthcare professionals, for the patients, even for the caregivers. So all the stakeholders, they are getting maximum benefit of the technology in nursing practice. So high quality patient care and delivering the safe patient care is the ability of the AI in medical technology. So certain devices which are there nowadays, they can help reduce medical errors, such as medication scanners. Whenever you are going to a grocery store or a mall or a market, everything is scanned and the bill is prepared, that we come across day-to-day life. So when we are talking about the medication scanners, so what are medication scanners? If the nurses, they are going to give a medicine to a patient, so when they are scanning the medication, if it's a wrong medication, the AI, the computer, the technology will alert the nurse to this discrepancy, prompting the nurse to double or triple check that the medication which she is going to administer before administering it. So this is a huge effect of technology, and it is a potentially life-saving benefit of technology that we come across in our healthcare setting. So technology, it helps in enhancing nursing skills. Technology can aid nurses and other medical professionals with medication administration. So automated IV pumps, this automated IV pumps, they can be used for giving the inotropic medications, the emergency medications, where we can completely see and deliver the medicine, administer the medicine with a particular drop factor, and we can see the changes in the ECG, the hemodynamic parameters of the patient, so which are very much useful in taking care of the critically ill patients. Obtaining the vital signs, that is the availability of the automatic blood pressure cuffs, the patient mobility things, electrical patient belts where they can manage their balance and equilibrium. So this is also one of the effect of technology in nursing practice. Then with the advancement in the technology, there is also increase in accessibility of nursing services. So accessibility is also increased. When we are talking of telemedicine and virtual nursing, so patients, they can visit with a nurse from the comfort of their home. So this helps save patients time and money and is especially beneficial to those with mobility issues who lack easy access to transportation and people living in rural area. So with all this, the accessibility of nursing services is benefited. So tele-nurses, they can gather admission histories, monitor patients, perform safety rounds, implement pain assessment, provide patient education, complete MRI or pre-operative checklist. They can write care plans and even sign off as a witness for another nurse administering medicines. So this is not only improving the staffing, but it allows the nurses for more flexibility and providing good environment. Then every one of you is aware about the nursing education. So AI is used in every field. Clinical simulation. So clinical simulation, where the nursing instructors, they can control mannequin settings. You all have done lab, like being in the nursing profession. What we are doing, we are first teaching the students in the classroom, then we are teaching the students, demonstrating the students with various procedures in the labs, and then only we are taking the students to the real life situations where the patients are there. So when we are talking of lab settings, in labs, nowadays very high fidelity mannequins are available. So nursing education, with the use of AI, use of technology, the nursing instructors, they can control the mannequin settings and replicate the specific clinical presentation for teaching purposes. So they can read the study and have the nursing student to interact with that mannequin and auscultating lung sounds, heart sounds, and even practicing inserting an intravenous cannula. Next is virtual reality. So virtual reality, when we talk about nursing education, clinical simulation, for years together we are using nowadays. Virtual reality is a new concept which has emerged few years back only. It is next to the clinical simulation. It is the use of headset and hand controllers to create an immersive student experience. And an instructor facilitates this experience using interactive softwares. I'll show you in my future slides where I'll show you the picture how a virtual reality environments they are created with the students, and the students, they are observed on the cameras, on the monitors, that how they are doing the procedure, whether they are properly following the steps of the procedure, are they communicating to the patient, are they using aseptic techniques. So this, although this style of simulation, it lacks the hands-on experience on the mannequins that is done in the clinical simulation. The cost of buying and maintaining a virtual reality system is considerably less as compared to the clinical simulation. and they are totally portable. So along with only one system will not work. So along with the clinical simulation, we have to also teach the students for virtual reality environments. In virtual reality, what is happening nowadays along with the simulation labs at many places in India, in nursing institutions, in esteemed universities, virtual reality labs, they are being set up where the students can experience these types of advances in the nursing education. So technology, it also helps in promoting the communication and follow up. As you can see in the picture very well, there's one hospital environment, then disaster response team is there, then remote healthcare is there. So hospital is the environment in which all the settings are perfectly done. So when we are talking about anything which is happening as a disaster, different types of, with the help of use of technology, we can get the resources from the hospital, and we can also do some have some remote healthcare facilities along with us. With hospital, with the help of remote healthcare facilities, we can reach to the disaster response unit, and from there the patients can be shifted to the hospital, or with the remote healthcare facilities, the persons, the victims, they can be managed on the spot also. So you can see different types of technology visuals in the picture itself, the use of airlift, the use of Wi-Fi, the use of then procuring the ambulance and the drones to provide the services you might have seen. So it also, technology helps in promoting the communication and follow-up. When we talk about the artificial intelligence or technology in nursing, as just now I have discussed, it enhances the nursing skills, it increases the availability of nursing services, it helps in re-imaging the nursing education, increases communication and follow-up, and it also reduces the stress and busy work. Next, we move on to the core delivery modalities. What are the different modalities that are used in telehealthcare nursing? One is the synchronous care. In synchronous care, the real-time virtual consultations between nurses and patients happen, including the facilitated virtual visits, where a tele-facilitator transmits the objective patient vitals from a clinic to a remote provider. The next is the asynchronous care. It is store and forward. Synchronous care, as you can see, it is the real-time virtual consultations that we are doing between the nurses and the patients. Asynchronous care is where we store the data and then we forward the data, where the patient information, including the photos, medical history, wound assessment records, it is all gathered and sent to the specialist or doctor for the evaluation later. That is called as asynchronous care, which is also a part of telehealth nursing. Third one is remote patient monitoring. So tracking patients' chronic conditions or vital signs using wearable or digital health devices. It also helps in monitoring of the patient from their home itself, and the nurses and the doctors, they can track the information whether the wearable devices, they are giving the results properly or not, or if there is any fluctuation, what interventions need to be taken in the course of action. Next is mobile health. So using mobile apps, you all know, text messaging, wearable technology to communicate with patients and promote self-management. So as it is discussed already, that mobile health is also playing nowadays a crucial role. Everybody is having a phone. They can download mobile health app. From there they can have many instructions, they can go through many of the health education aspects, even they can have the teleconsultations with the nurses as well as the doctors, the other healthcare team members. So these are the core delivery modalities, which includes the real-time virtual consultations, store and forward the data, remote patient monitoring, the patients who are in the slum areas, in the underserved areas, at any geographical location. So tracking the patients as per their the parameters related to their chronic health issues. The remote monitoring is there, then mobile healths are very well available. When we talk about the nursing domains for telehealth nursing, there are clinical nursing specializations, tele-triage, primary care nurses in care, in which the nurses they assess the patient's symptoms, determining the appropriate level of care, severity, and urgency via phone or video. So this is tele-triage, which is a part of emergency care. Then telepsychiatry and mental health, in which the delivering of virtual therapy sessions, medication management, and psychiatric support are initiated. When we talk about the long-term and geriatric care, it helps in providing remote nursing services and telemonitoring for residents in skilled nursing facilities or homebound patients to prevent any kind of complications. So these are the different domains where the telenursing is very much helpful. Then if we talk about the specialized care, in the specialized care, it helps in assisting the patients with their physiotherapy, physical therapy, neurology patients, for example, CVA patients. They can during the rehabilitation, once they're discharged from the hospital, so in the follow-up care, in after getting the discharge in the home, this specialized care in which the nurses they are providing the education to the patients, that what are, how they can prevent the complications and how they can do their self-care, like stroke patients, some head injury patients who are not completely functional, they are partially dependent on others. And pediatric teleconsultations are also there in the specialized care. So next, we move on to the patient education and support. Just now, I have told you that these apps and use of technology and telehealth nursing, it helps in health coaching and chronic disease management, educating the patients to manage conditions like diabetes, heart failure, tracking symptoms, preventing acute hospitalization. All these are the purposes of telehealth nursing. Digital literacy. So being nurses, digital literacy is required by the nurses as well as the patients, as well as the consumers of healthcare. The public should know what is digital literacy and how much accessibility is there. Most of the areas we are talking about, when we talk about a metropolitan city, all the people who are there in the metropolitan cities, they must be very much aware of different health apps, the teleconsultation aspect of nursing, as well as the medicine or other healthcare teams. But when we talk about the people who are working in the, who are residing in the rural areas, the slum areas, those who are not having any sensitization related to tele consultations, so they have to travel 150 kilometers or 200 kilometers to reach a healthcare facility. So for these people, digital literacy sensitizations should be there. And because this telenursing, it overcomes the geographical barriers by ensuring patients to understand how to use telehealth portals, how to use telehealth apps and the connected devices. And being a telehealth nurse, we have to know about the legal and regulatory compliance also. We have to see like virtual nursing practices. They should comply with the patient privacy laws also. Patient safety is utmost important. Standardizing how the remote consultations have to be done, how the surveillance has to be done, how the evaluations are handled ethically and securely. This is the responsibility of a telehealthcare nurse. Telehealth nursing competencies, it has these competencies in which we are training nursing students also nowadays and current practitioners in virtual communication, in website manner and clinical virtual assessments, in which the performance evaluation is also planned. Like something new is coming up in the technology or anything, we are teaching as a team of healthcare. We are teaching and achieving the competencies to that level where we can directly use that technology in a positive manner. If we doesn't know the technology, we will have too much errors which can happen in the future. So first, the planning is done when we are talking about the telehealth nursing competencies. So planning of the competencies which are required by the healthcare professionals, preparing a layout that how the competencies has to be inculcated into the students or the nurses, then providing them proper resources, how they can get training regarding that, like how they have to speak, how they have to call the patients, how the system is going to work, and ultimately the performance evaluation is done. So all the telehealth programs, they are planned properly, prepared, and provided to the healthcare professionals, where when they once the authorities they are satisfied with the performance evaluation, then that competent persons are only taking up the
এখানে একটা ইয়ে হচ্ছে জানো কনফারেন্স হচ্ছে
sessions. Kindly mute. So technology is transforming the nursing practice and expands the access to healthcare in different ways. We have already discussed, I'm not going to go deep into this. Remote patient monitoring, workflow improves, administration improves with the use of electronic healthcare records and telehealth apps. Virtual consultations can be done. Advancing nursing education, it helps in advancing the nursing students' capabilities to participate in simulation-based and continuous professional development programs. So when we talk about the advantages, we have to speak about the disadvantages also. So when we come into the advantages of technology in nursing, it leads to improved communication, improved patient care, which is the ultimate goal of any healthcare providers. So communication will be improved. It helps in improving the patient care, improved accessibility, decrease human error, because the technology is going to warn you that this is what you are going wrong. As I discussed the example of medication error, better education, the nursing students, they are getting better education, the patients, they are getting better education, and it can positively impact on the nurses shortage. So how it is going to positively impact on nursing shortages? Because even a patient a person who's having a mild problem in the remote setting, they are having mild problem of chronic pain or some other gastrointestinal upset, or so the symptoms are there. So first, if they are trying to go for the teleconsultations, the telehealth nursing is utilized, they can reduce their logistic cost also, that they don't need to visit to the hospitals. Once they are coming to the hospital, they are having hospital management is required at that particular time. So we can save our nurses and healthcare providers from there also. And now likewise, you can see, like, if all the patients who are with mild conditions, they are going directly to the tertiary care centers rather than using the primary healthcare facilities, or the district hospitals, they are not going. So what is going to happen? The tertiary care centers, they will have lot of burden. So it is on the part of the system that we have to go as per the hierarchy. So first, if we are initiating the teleconsultations, after that the patients, they can reach the PHC, CHC, or the district centers. And then if they are referred to tertiary care centers, if the problem is more, or if the like the diagnosis is like that, the doctors, they are going to refer to the tertiary care centers. So this positive impact on nursing shortage can be addressed this way. But the public should know, the people in our country, they should know that these are the different facilities available. So what are these all are the advantages of technology. When we talk about the disadvantages and negative impacts of technology in nursing. So if a person is coming, is meeting us personally, like physically, like in person, if we are speaking to somebody, the communication will be more. But if we are speaking on teleconsultation, or if we are giving a call, the person may have some problem or some challenges in communication. So the negative impact of technology is there is decreased interpersonal communication and patient interaction is less. Maybe few of the things the patient is able to verbalize, few might not be able to discuss. Then second negative impact is potential for data breaches and privacy concerns. So as I've discussed with you, legal and ethical concerns regarding to tele nursing and telehealth care, it is when we are having the data with us, the data should be highly confidential and privacy concerns should be kept in mind. If there is loss of data or the data is leaked to somebody, so it can have very fatal effects. Then high initial costs and maintenance expenses are required as we talk about the wearable devices, internet of medical things. Then if we talk about the remote patient monitoring, or then virtual reality. So all these are having high initial costs and maintenance expenses. So there are, when we are initiating with the new things, so there are challenges in implementing and integrating the technology. There can be sometimes technical issues, and system failures can also have a negative impact. So these are the advantages and disadvantages of technology. What are the different areas where we can work on as a nurse? I am talking about that where these telehealth consultations are done. When we talk about elderly patient, in elderly patients with chronic heart failure, how does the remote monitoring of vital signs compare to patient in person clinic visit affects the hospital readmission rates within a year of follow-up? So these are few of the questions which I have tried to make you understand that how the remote patient monitoring is going to affect the outcome. So these are the PICOT questions you might have studied in the evidence-based nursing practice also. So when we are talking about here, the P is the patient, the elderly patients. P is the population, the elderly patients with chronic heart failure. I is the intervention. What intervention we are going to give? Remote monitoring of vital signs we are assessing from the patient. We are having devices where the monitoring of vital signs is there. C is comparison. What we are going to compare? We are going to compare the traditional method with the the remote monitoring with the in-person clinic. So whether it is affecting the hospital readmission rates, is the outcome, is there any decrease in the hospital readmission within a year of follow-up? Within a year is the time frame. So when we are thinking about all these, so we can, if we are doing a study on this, so we will come to know the results that majority of the elderly patients, it can be there or it cannot be there, that majority of the patients, there is reduced hospital readmission rates because of the remote monitoring of the health vital signs. Similarly, when we talk about pregnant women, so as we have discussed in the previous sessions also, that for pregnant women, the antenatal mothers, there are various apps which are installed and prepared by the government. So when we talk about the pregnant women with gestational diabetes, what is the effect of telehealth-based dietary counseling? When we are doing telehealth-based dietary counseling, what is the effect on maternal and fetal outcomes as compared to the traditional in-person counseling during the antenatal period? So with this also we can come to know, because this is the trial and error phase where we are seeing what are the effects on the community. So whether this method of telehealth related to dietary counseling is effective, or the traditional in-person counseling when the patient is coming, antenatal mothers, they are pregnant women, they are directly coming to the obstetrics OPD, whether they are more benefited with that, or they are the telehealth based dietary counseling is having a good impact on the maternal and fetal outcomes. Patients who are recovering from any orthopedic surgery, it is not possible for the patients to be admitted in the hospital for months together. You all know that the orthopedic surgery, the time of recovery is more. So, with the help of remote physical therapy sessions on functional recovery, in comparison to the conventional hospital, that physical therapy sessions during the hospital during the rehabilitation phase. So whether there is any impact of remote physical therapy sessions which are conducted far away from the patients when the patient is in the hospital, and the sessions are far away with the help of teleconsultations, whether they are going to improve the functional recovery of the patient. And we have to compare whether the conventional methods are good or the remote physical therapy sessions are benefiting the patients in the rehabilitation phase. So like this, I have given example of patients with asthma. What is the effect of remote asthma management education compared to in-person education on the frequency of asthma exacerbations during a 1-year follow-up program? So these are few studies which have come to my mind, and I have searched that these can be done in future to see what are the effects of these all modalities in relation to telehealth care. So the modalities that are used in telehealth nursing are live video conferencing, where you can do you can use various video platforms providing assessments, consultations, professional health-based educations. So nurses, they can use synchronous telehealth care or offer basic consultation for acute or chronic care. Then phone consultations, in which the nurses, they connect with patients over the phone, offering guidance, triage services, answering health related questions. Then email communication also comes under telehealth nursing. The nurses, they interact with patients via emails, addressing non-urgent inquiries, sharing resources, and facilitating follow-up care. So these are the things which we are having in the telehealth care nursing, but we should tell to the consumers of care also that these are all the facilities which have to be utilized in taking care of their self-care. Remote patient monitoring, then mobile health applications, then store and forward, where the nurses, they receive all the information and forward it for consultation, and virtual clinics. So areas of telehealth nursing practice includes the telepediatrics, telecardiology, telehome care, telestroke care, teletrauma. You all must be very much aware of all these different branches of nursing and healthcare: teletriage, forensic telenursing, telemental health, tele-ICUs, tele-rehabilitation. So these are the different areas of telehealth nursing. Now, when we talk about the technology, so much we have talked about the technology. What are the technical problems or the challenges that are faced by the nurses related to technology? So the various technology related challenges include the broken or malfunctioning equipment, lack of uniformity. One company will have different types of IV pumps, the other company will have vary as per the facility. Electronic medical records, computers or device freezing when they're not working properly, dead battery of the devices unavailable during updates. When the devices are updated, like your phones, as a simple example, all the devices which are with the technology, they need to be updated. Even though like the cars which we are using, automatic cars, they need to be updated. So limited training on these aspects by the nurses. If the nurses, they are not trained for these all aspects, it will help in disrupting the workflows, change the fatigue. Too many technologies, new technologies are coming up, so the nurses or the healthcare providers, they will be bombarded with different types of technology. So they need time to understand, to get training about that, so that they can use them for the patient care. Varying comfort levels using technology, that can be also a challenge. Understaffing can be challenge, in which the technology can be hampered. Burnout and mental health can be affected when we are using the technology or telehealth. It is very tiring to do teleconsultations for hours together. Then if the workforce is aging workforce and retirements are there, then also uh, the persons who are aged, they are less receptive to the new technological changes which are coming up. And inadequate pipelines for new nurses can be there because we are using teleconsultations, telehealth nurses. Technology adaptations trains are also there. So when we are adapting new technology, it will take time for the technology to be fully functional. Once all the healthcare professionals, they are equipping themselves with the technology, with these aspects, then these adaptation strains can also be there. So now, what are the roles of technology role in addressing the nursing challenges? So whatever nursing challenges I have discussed now, so how we have to overcome these challenges? How the technology is only addressing these nursing challenges? We have advanced data analytics. Advanced data analytics is whatever data we are receiving on the softwares, it can help the predicting the patient admission rate, what is the staffing schedule, how many nurses are required in particular ward as per the census. So technology is addressing the nursing challenges. So technology is going to help us in earlier we used to prepare the rosters of nurses, different ward nurses. We are manually preparing, we were preparing. So if we are using technology in all these aspects, so all as per the data entered into it, the data will analyze for which particular ward, how many nurses are required, which nurses are there. Then EHR and analytics platforms. So EHR is, despite the challenges associated with the complexity, EHR are the electronic health records. So electronic health records, they are invaluable for the ability to consolidate and analyze patient data efficiently. Previously, we used to prepare all the files of the patient. Everything is kept in the file. If that page is lost, so we will not be able to do anything. So nowadays every hospital is having hospital information management system, that is HIMS. So in that HIMS, all the different records of the patients, they are stored, all the electronic health records are available, so it can be used, it can be accessed and keep the data safe, secure, and it can consolidate various types of informations, and we can do analysis at any point of time regarding the data. So this consolidation aids in clinical decision making and ensures continuity of care across different healthcare settings. So telehealth and remote care technologies that we have used, that also helped in addressing the nursing challenges, mobile solutions and apps, simulation and training technologies, virtual reality and other simulation techniques. What are the emerging technologies in nursing? What are the emerging technologies in nursing? So first one is artificial intelligence, then Internet of Medical Things, wearable devices, virtual reality, electrical health records, electronic health records, clinical decision support system, remote patient monitoring, and mobile health apps. So quickly we will have a review on this because we have discussed these topics previously also. So artificial intelligence. So artificial intelligence, it refers to the computer systems that perform tasks requiring human intelligence, such as learning, reasoning, decision making, and recognizing the patterns. So how AI is used in nursing? It is helping in patient monitoring and early detection of cases, streamlining the administrative tasks regarding the patient care. AI reduces the time spent on documentation and scheduling. It allows the nurses to focus on the patient care. Then AI also helps in clinical decision support making systems. It analyzes vast medical data to assist nurses in making informed evidence-based decisions. And it also helps in providing personalized patient care. So AI tailors treatment recommendations by analyzing patient history, lab results, and medical images. So now all of you are using different chatbots, the chat GPT you people are using. So whatever input you are giving to chat GPT, likewise the results are coming in the chat GPT. So here I'm not saying to use AI like chat GPT or something, but we are having specific chatbots which can be used in decision making by the healthcare providers. The next is Internet of Medical Things, IOMT, and wearable health technologies. IOMT is a network of connected medical devices that collect and exchange patient health information through internet. So what we can do, home healthcare, we can manage remote ICU monitoring, we can do continuous patient monitoring can be done, and automatic recording of vital signs can be done. Chronic disease management. This is the use of network of connected medical devices. So I'll tell you what are the three main components of Internet of Medical Things. So as you can see in the picture, the physical layer is there, then data integration layer is there, and application service or presentation layer is there. So in the physical layer, you can see various types of wearable devices. They are shown in the picture. Just to tell you that these are all smart devices which are coming up. Nowadays, you people are having smart watches, which is monitoring your heart rate, BP, all these things. So, sorry. So physical layer, it includes the smart earphones for balance and equilibrium, smart helmet for any kind of accident prevention, smart glasses for vision, smart watch for various vital signs, smart bracelet also to check the pulse, to check the breaths, then smart shoes for balance and equilibrium. So all these comes under the physical layer where the devices are there. And these devices, they are connected to a particular database. The data integration layer is showing the database. So what this database is using, it is collecting the information from that physical layer. It is collecting the information and it is collecting the data and filtering the data which is redundant or which is false or misleading or which is not required, that is being screened and filtered at this level. And finally, the data analysis happens, and in that analysis, whatever results are coming that the patient's, this person's, this particular parameter was changing at this particular frequency or at this particular time of the day. So all these informations, they are analyzed, and ultimately the application service or the presentation layer, it is going to this information is directly delivered to the hospital monitoring system. So in the hospital monitoring system, it is assessed, the doctors and the healthcare providers, they will assess and they will see if any kind of services are required. If it at the time of emergency, they want to have the patient in the hospital setting, so emergency services are also provided. Like this, many kind of complications can be prevented with the help of Internet of Medical Things. This is the same which I have given you the overview in the picture: physical layer, data integration layer, and data processing, and along with the presentation or the application service, where even emergency services, automatically it alerts the emergency medical services, the ambulance, when critical health events such as falls, cardiac emergencies, or abnormal vital signs are detected. So electronic health records, you all know, digital versions of patient health records are accessible by authorized healthcare professionals. So patients' demographics, patients' medical history, lab reports, medication records, nursing notes, care plans, all can be accessed with the help of this database, which we can retrieve at any point of time. All these databases, all these technological gadgets which we are having, it helps us. These electronical health records also, they are going to help the healthcare providers, the technicians, clinicians, the computer-based systems that assist healthcare professionals in making evidence-based clinical decisions. So as you can see in the picture, the patient data is there, history, symptoms, lab results, vital signs or medications, all the records are there. So these records, they are collected, analyzed, and recommendations are generated. And these recommendations are sent to the clinician, in which the diagnosis suggestions will be there, treatment options can be there, and alert warnings can be there. So finally, the clinician will help in deciding that what should be the decision at that particular time, which is best possible and which is going to prevent any kind of complications. So this is also a part of telemedicine nowadays. Then virtual reality and simulation based teaching, I have explained already that it creates an immersive computer generated environment for learning and therapy. The nursing application of this VR and simulation based teaching is it helps in clinical skill training of the nurses, nursing students, emergency simulations, pain management, mental health therapy, it can be used, and for patient education. So in the first picture, you can see the procedure of basic life support is being done. So in this, the nurses, the nursing students, they are given some virtual scenarios, and in that they are doing the procedure, and it is being recorded, and the instructor or the tutor is observing from the other end whether the procedure is done properly or correctly or not. And in the second picture image, you can see that the procedure is done on the in the clinical simulation lab, where the auscultation of lung and heart sounds is there, and the student nurses are doing, and passively they are being observed for whether the procedure is competently done or not. So remote patient monitoring, in that also we have discussed remote patient monitoring system. It includes the monitoring parameters from a remote location. It allows the technology, helps the healthcare professionals to monitor the patients outside the healthcare facilities, as we say, remote patient monitoring. So blood glucose can be monitored, blood pressure, oxygen saturation, weight, ECG, temperature. So what are the effects of this remote patient monitoring initiative? Is to reduce the hospital readmissions, better chronic disease management, improved access to care, and lower healthcare costs. Mobile health apps, they can help in providing medication reminders to patients. Health education apps can help in health education. Appointment scheduling with various apps. Teleconsultation platforms are also available. Pregnancy monitoring apps. So these all apps, they help in patient education, follow-up care, health promotion, and lifestyle counseling. So next, I'll move on to the government and public initiatives. So all of you must be aware of eSanjeevani app. So how the telemedicine works, how the telenursing works. So from you can see how this app works. So it's a very user-friendly app, in which the step one is to register for the registration and token generation. Yeah. Then second is the login, where we have to log in. We have to wait for the SMS, like we are doing for the other apps also. In step 3, waiting room will be there, in which a call button is there, and then we can start a video call. And step 4 is the consultation will show up with the doctor or and the nurses, and the consultation will be done, and instant e-prescription will be done. So this is eSanjeevani app, which is being utilized in India. India's flagship free-to-use national telemedicine service. It has facilitated over 36 crore remote consultations. Operating on a hub and spoke model, it connects millions of patients and remote primary health centers, which are now renamed as Ayushman Arogya Mandirs, with specialized doctors and medical colleges. Next is the telemanner. So it is not possible for me to speak everything about this telenursing in this short period of time. just 1 hour. So I have taken majority of the things into it. So kindly you can refer the different platforms which are also available online. So Telemanas app is the national mental health program. It is providing free round the clock mental health counseling and care access across India. So it is by the Ministry of Health and Family Welfare. So over 14.7 lakh calls received on Telemanas helpline since October 2022. So 52 Telemanas cells are there, 23 mentoring institutes are there, and 5 regional coordinating centers are there. So it provides a toll-free number, that is 14416, for easy access to mental health support. So what is the process in which the caller dials this particular Telemanas helpline number? There is then the person will be connected with the automated voice-based system that we come across for all the apps. So when we are connecting to that, then that app will help us in providing the counselors and trained and accredited people who can counsel us. So whatever are our, they will have interaction with us, and if we are suffering from anxiety, stress, depression, so we can discuss that situation, that counselors are going to take care. And once the the work of counselor is done, then the patient is further advised to go for mental health specialists, where clinical psychologists are available, psychiatric social workers are available, and psychiatric nurses or psychiatrists will be available around the clock to speak on the issues to resolve the mental health problems. So this is e-Sanjeevani app, and it is also providing the in-person services at the health and welfare clinics, primary health centers, community health centers, subdivisional hospitals, and mentoring institutions, and even tertiary healthcare centers. Then all of you know about the Ayushman Bharat digital mission. So it's a digital backbone of India's health sector, integrating the electronic health records, unique health IDs, telemedicine providers to create a seamless, paperless healthcare ecosystem. So where the individual healthcare providers, they will have unique identification, unique IDs will be there. Then there will be unique healthcare professional registry is there, in which all healthcare providers, they have to register themselves. Then health facility registry has to be done, comprehensive registry of all health facilities across different systems of medicine, let it be Ayush, that is Ayurveda, Unani, Siddha, any type of healthcare facility. Then health records. So electronic health record of an individual's health related data that conforms to interoperability standards, which can be accessed by multiple sources, which being owned and managed by the individual. So these are all the components of Ayushman Bharat digital mission. When we talk, so these all apps are which are run by the government sectors: e-Sanjeevani, Telemanas, and Ayushman Bharat. So private corporate platforms which are available as a part of telemedicine and telenursing are Apollo Telehealth, as one of the oldest multi-specialty telemedicine networks in South Asia. It operates public-private partnership, tele-ICUs, and specialty remote clinics across urban and rural locations. So here, the immediate, easy, and affordable treatment advice is given by highly qualified, experienced doctors. We can save unnecessary travel expenses by taking this app. Free review within 7 days is available, and quick response if we are mailing any queries. So the consultation timings are also there. Along with this Apollo Telehealth, other teleconsultation apps are Tata 1MG. It's a comprehensive digital health platform offering remote doctor consultations, at-home lab testing, e-pharmacy delivery. Practo, one of the most prominent telemedicine firms, connecting patients with remote healthcare practitioners, specialists, in clinic appointments through its software. MediBuddy, it's also a digital healthcare platform that covers teleconsultations, medicine delivery, and corporate health benefits. When we talk about the tele-nursing initiatives, so Trained Nurses Association of India, the headquarter in New Delhi, it is also having They widely conduct webinars and nationwide upskilling drivers such as the Digital Health Foundation courses for nurses, which trains the nurses as healthcare data management and national telehealth platforms. So NIMHANS Bangalore, it is also the National Institute of Mental Health and Neurosciences. It is the authorized tele-nursing practice guidelines, which establish SOPs for triage, remote patient monitoring, tele-mental health. So they are also the partners with TNAI to host training conferences for nurses on massive government telehealth projects like Telemanas. Telemedicine Society of India, it is also there, multidisciplinary, they are conducting the conferences, and digital health committees frequently integrate telenursing practices. Then Indian Nursing Council, which is a statutory body that governs nursing education, they also outlined the curriculum and integration of digital health and telehealth competences into standard nursing education. So recently in 2021, the curriculum for BSc Nursing has been revised, and one of the a subject that is added into the nursing curriculum is nursing informatics. So in that nursing informatics, the information regarding technology is given. And as a part of the university initiatives, and I'm talking about my university, so last time we have taken an initiative on in collaboration with IBM India, we have conducted a value added course of 45 hours related to data analytics and summarization. So these are the different areas where we need to work on, and we can prepare our student nurses for future telehealth nurses and user friendly, technology friendly persons, so that they should not face challenges in the future time. So in the last few slides, I am just going to summarize about various research studies that are being conducted, that are already conducted and are published in very good journals, very highly indexed journals on telehealth nursing. So as you can see in the slide, telehealth nursing practices for the relief of symptoms in patients with cancer, a qualitative study. So this Elsevier has published this article in the year 2025, in which they have told that these telenursing practices, they relieve the symptoms in patients with cancer. A qualitative study they have conducted for 1 year, and they have come to a conclusion that the participants, they have the participants experiences, they have done thematic analysis and analyze the data, and they have analyzed that these practices, they relieve the symptoms in patients with cancer. The next is use of telenursing in primary care, which was published in PubMed Central in 2024, a qualitative study on its negative and positive aspects. So here, the study was conducted on 68 nurses, and their statements, opinions, and perceptions were analyzed, and 28 descriptive codes were obtained. And then it was categorized into positive and negative. So nurses positively value the usefulness of digital tools. Here, the participants were nurses. So nurses, they positively value the usefulness of digital tools and identify a wide range of benefits of telenursing in daily practice. At the same time, they pointed some crucial limitations that may slow down the adoption of telenursing. So this was related to digital literacy. So digital literacy is required to both patients as well as the professionals. So the nurses, they considered that telenursing can humanize the care, but they insisted on the need to prevent its use from increasing health inequalities. Then you might have heard of India's first nurse-led hospital in Bangalore. So it's an initiative taken by Dr. Devi Prasad Chetty, the chairman and founder of Narayana Healthcare, has announced the first of its kind initiative in Bangalore, where nurses will not only take care of patients, but they will also run the entire hospital administration. So for equipping us with all these things, then only we can have entrepreneurship skills, we can have leadership skills, we can do administration as nurses. So this is the first of it hospital, where the nurse-led smart hospital, where the nurses will be working at all the levels of the hierarchy. Then effectiveness of telehealth nursing in improving the self-care and blood pressure control among adults with chronic hypertension. So it was a study conducted in Turkey in 2025, and the study assessed that the hypertension is a significant public health care issue with many patients experiencing poor control despite they are having treatment, highlighting the need for self-care strategies. So this study was an 8-week structured telenursing intervention which significantly improved the blood pressure control and self-care efficacy among adults with chronic hypertension. So likewise, the studies on self-care among patients with diabetes mellitus, with some rehabilitation of patients with the stroke, and with orthopedic surgeries can be done, are being conducted nowadays, suggesting its potential as a valuable tool for managing the conditions in resource limited settings. Then telenursing, the future of remote care for healthcare efficiency and accessibility. So the growing demand for healthcare services coupled with global shortage of all healthcare professionals has led to need for innovative solutions to improve the care efficiency and accessibility. The article was published in ResearchGate in April 2025. So coming to the conclusion of the session, so few takeaway messages from my side in relation to use of technology in telehealth nursing that we have discussed today. So telehealth is transforming nursing care by making healthcare more accessible, timely, and patient-centered. Technology complements, not replaces nurses. Compassion, empathy, clinical judgment all remain at the heart of nursing practice. So telehealthcare, it bridges the healthcare gaps. Nurses are the key drivers of digital healthcare. Digital literacy is now very much essential nursing competency for safe and effective patient care. Patient privacy and data security must always be maintained during virtual consultations. Telehealth support, continuity of care is required. Artificial intelligence, wearable devices, and remote patient monitoring, they are expanding the scope and effectiveness of telehealth nursing. Successful telehealth depends on collaboration among healthcare professionals, patients, caregivers, and technology providers. So finally, I will conclude the future of nursing is hybrid, integrating in-person and virtual care to deliver better healthcare outcomes. So technology extends the nurse's reach, but compassion remains the nurse's greatest strength. So I repeat, technology extends the nurse's reach, but compassion remains the nurse's greatest strength. So thank you all for your patient listening. Together, let's shape the future of healthcare. If you have any questions regarding the session, you are welcome. Thank you very much for your patient listening. And this is my email ID and contact number. At any point of time, if you are having any concerns related to the topic which was discussed today, so you can connect to me. So once again, thank you from my side.
You can see the PPT?
Yes, ma'am.
Yeah. So let us start with the cultural competencies in nursing. We all know, India is one of the world's most culturally diverse countries. Making cultural competence is and especially the skill of healthcare professionals, especially nurses. So we know cultural competencies in nursing is very important as a nurse. And the key aspects of cultural competence in Indian context include linguistic diversity. We know because we Indians, we move all over India and global. So linguistic diversity, India has 22 officially recognized languages and hundreds of dialects. And religious diversity is another thing. We have got so many.
वैसे भी तुम लोग को रिवीजन तो करवाना नहीं है हाँ
and caste, tribe, and community. The third one is caste, tribe, and community, and tribal system of medicine. That is also there in India because it's a challenges for the healthcare workers to manage the cultural diversity. That in this case, many patients used to believe in Ayurveda, Yoga, Unani, Siddha, homeopathy. And same way, the family-centered decision making in many Indian families, healthcare decisions are made by collectively rather than by the patient alone. It is a full family will be taken care of the decision making. So dietary practices, that is also another challenges we face in the cultural diversity. Vegetarianism, religious food restrictions, fasting, and cultural dietary preferences. And gender and modesty consideration is another one. Some patients may prefer healthcare providers of the same gender or require privacy during the examinations. The same way, health literacy and socio-economic differences, cultural competence also involves adapting communication to different educational, economic, and rural urban background. So we have a lot of challenges as a nurses or healthcare workers. We have a lot of challenges to manage the cultural competencies. In that, let us see what is cultural competency. In the cultural competency is the ability of nurse to provide a safe, respectful, and effective care of patients from diverse cultural, religious, linguistic, and social backgrounds. It improves the communication, trust of patient outcome. So we all know that we manages even the overseas patient also. Even the state-wise, we have a lot of problems. And the same way, even the patients comes from the India is a hub of the overseas. So overseas patient comes, for example, the overseas patient comes to the hospital. So how you will be? We will be using interpreter and explain the medication in a simple language, ensuring the informed consent. So the same way, let us see the objectives of today's session and developing positive attitude towards cultural differences. We nurses, we have to develop develop the positive attitude towards the diversity, understand one's own biases, gain knowledge and cultural practices, improves cross-cultural communication. So, for example, if we look at when before the students go to the clinicals or community posting, so we have to reflect their own beliefs before community posting to avoid stereotyping tribal populations. Because we get the students from a different areas, urban and rural. But once they go and post in the rural areas, the students should understand one's own belief before community posting to avoid stereotyping cultural population. So that is the components of cultural components. The cultural competencies for nurses, these techniques are built upon three pillars. The first one is knowledge, and second one is attitude and the skill. So the knowledge, learn about beliefs and customs. That is, as a nurse, we are supposed to look at this part. They learn about the beliefs and during the education period itself, we should understand the patient beliefs and customs. And then attitude, respect the differences without the judgment. That is also very, very important. And the skills, the communicate effectively, negotiate, care, and adapt practice. So then let us see the under knowledge. The learning about the cultural base and those in your areas are first step in strengthening your cultural competence. Developing on location, the number of cultures you encounter will vary. Seek out the information on topics such as shared traditions and values of each cultural group. So in this learn model, we can just learn about this. This is a learn model, and under knowledge, how we have to identify the patient. And learn, L stands for listen to the patient perspective. Then E stands for explain your clinical assessment. And A stands for acknowledge similarities and differences. R is recommend evidence-based care, and N is negotiate a mutually acceptable plan. So when the patient comes to you and when they talk about, you have to listen the patient and with sympathy and understanding to the patient perception of the problem. That is the L. And send again, explain your perceptions of the problem. The clinical, that is your clinical assessment. Then acknowledge similarity and differences. We will have, as a nurse or medical care professional, we have our own similarities and differences and recommend the evidence-based care, and next negotiate the mutually acceptable plan. For example, the diabetic patient want herbal remedies. When the patient comes to hospital, they have their own herbal remedies. They want herbal remedies. The nurse has to listen. The learn model first, the nurse has to listen, then explain the risk of the herbal remedies, what they are going to take. Then later part, the third one is acknowledges cultural beliefs of the patient and recommend insulin or any medication, negotiate, and later part, the last part is negotiate safe concurrent use after physician review. This is a learn model we have to follow to the patient to make understand the cultural competence as a nurse. Next, the next component is attitude. That is attitude and self-awareness. Attitude plays a large role in the ability to become and serve as a culturally competent caregiver. In this case, attitude refers to level of awareness in yourself and your patients in regard to stereotypes and roles of the roles and the communication. The nurses should recognize unconscious bias and avoid assumptions based on religion, ethnicity, and socio-economic status. Always we have that our own perception as a nurse. When we work in the hospital, we have our own unconscious assumptions based on the religion, ethnicity, and socio-economic status that we cannot follow with the patient, because we have to understand their cultural competence properly. Then only we have to modify our attitude and self-awareness. For example, do not assume every elderly patient want family in members to make decisions. So we always, their elderly patient is admitted in the hospital, we expect we will be waiting for the relatives to come and then to take a decision. No, it is not always. This is our assumption. So this is, so sometimes we have to accept the understanding of the patient and ask the patient preferences also. So this is attitude and self-awareness. Then comes to communication, and that is communication skill. The skill is the third component is skill, that is communication skill. Use interpreters, simple language, and technological back method and non-verbal communication we can use. So you can use it also learning to adapt in new and different situations in a flexible way. And remember that the hospital environment may not be familiar ground for your patients. So for example, if in the skill, how we have to understand a hearing impaired patient receives written instructions and sign language support. So we have to receive before the hearing impaired patient is there in the hospital with us. So you have to give written instructions, and sign language support has to be taken to understand the communication skills of the patient. Next, what is the cultural, why this cultural competence is nursing is important? Cultural competence improves adherence, patient satisfaction, safety, reduce conflict, and equitable care. For example, the respecting vegetarian or dietary preferences improves nutrition complaints. And then if you see that, you can see we all have gone through so many issues in this. They have their own beliefs. No blood transfusion is taken from some patients will reject the blood transfusion. Abortion bans are against my religion. So these are that is why we should understand that as a nurse, we should understand the cultural competence and how to manage the patients in a different components. We have to use it in this. Next is cultural factors. Cultural factors affecting health and disease. Social, in order to improve the health behavior and community, the cultural factors affecting health behavior and healthcare services need to be clearly recognized. In that, we have to look at the socioeconomic status of the patient, religion, family rules, gender, nutrition, pregnancy practices, and hygiene and traditional healing, substance use, and end-of-life beliefs and influence care. So in that, cultural factors is in this, we have to look at and practical application. How the practical application has to be done in cultural factors affecting health. In that practical application, respecting dietary restrictions during hospitalization, incorporating patient cultural beliefs into care planning, and using interpreters for patients with language barriers, building the therapeutic relationship based on trust and mutual respect. So what are the challenges? So the challenges we face, a lot of challenges we face in this, and in that, the unconsciousness biases. Language barriers is one of the main challenges we face. We all know in even India, the different state has got a different languages. The patient won't be. So language barriers is one of the big challenges. Limited cultural knowledge. That is also, if we go to any other place to work, and we should have a proper knowledge about the cultural knowledge about that environment, the limited knowledge and language differences, unconscious bias, and time constraints in busy healthcare setting. That is also biggest challenge we face, time constraints, because we nurses, we are always busy with so many things, so we cannot understand the patient, the side of the patient. So that this is also another challenges we face. The workload, conflict between beliefs and medical advice. What are the strategies we can use it to overcome these challenges? Continuous education, reflective practice, shared decision making, culturally tailored health education, community partnership. So these are the ways only we can overcome these challenges. And this example, for example, the conducting diabetes education in local language with culturally relevant diet advice is also help us to resolve these issues. The next point is cultural competence begins with recognizing that every patient brings a unique story, and excellent nursing begins by listening to that story with respect. Culture and its influence on health. So what is culture influence every aspect of health, illness, healing, and healthcare decision making? So in that cultural influence, it shapes how individuals perceive health, illness, and suffering, pain, disability, death, and healing. Understanding these influences enables nurses to provide holistic care. So in that, it shapes how people recognize symptoms, when they seek treatment, whom they trust to advise, and whether they accept modern medical interventions. Nurses who understand cultural influences are better equipped to provide holistic patient centered care and respect beliefs while maintaining patient safety. In that cultural influences, there are a lot of cultural influences are there in this culture and health seeking behavior. What is health seeking behavior? It varies across cultures, and some individuals immediately visit hospitals, and while others first consult family elders, spiritual leaders, and traditional healers. We know that when the patient comes to hospitals, all the patient will not be coming directly to us. Then they will be visit hospitals, while others visit consult family elders, spiritual leaders, and traditional healers. And the same other cultural influences, acceptance of medical treatment, cultural belief, influence, and understanding of disease cessation. Some communities attribute illness to infection or genetics, whereas other may relate to illness and spiritual imbalance, fate, or the other evil eye. So we know dietary practices. Another one is dietary customs influence nutritional care. Religious or cultural restrictions may affect food choices during illness. Then family involvement. That I already spoke about the family involvement. Family involvement differs considerably in many Asian cultures. Families actively participate in healthcare decisions, whereas Western cultures often emphasize the individual autonomy. Then the last one is end of life decision. That is very, very difficult to manage this. As a healthcare workers, we all know end of life care is strongly influenced by cultural and religious beliefs regarding life support, pain management, organ donation, and funeral practices. In that, you will have to identify and understand the patient cultural demand. As per that, we have to manage it. For example, if we see the examples, One example I'll tell you: a Muslim patient fasting during Ramadan may require medical schedules adjusting without compromising the treatment, because we know the treatment is our medication administration plans are with us, the chart is with us, but when we think about the patient, the cultural, so they are fasting throughout the day and only night there, so we require the schedule has to be rescheduled as per the patient requirement without compromising the treatment. That is one example what I'm trying to tell about the cultural competence. In the same way, another example: a Hindu vegetarian patient who receive vegetarian meals during hospitalization, we have to make sure that the patient is getting the vegetarian meal instead of getting any other type. So these are the things we have to, as a nurses or healthcare professional, we have to look at it. And other practical implications are: failure to recognize cultural values may lead to treatment refusal. Once we are not following the cultural values of the patient may refuse the treatment, and poor compliance, delayed recovery, dissatisfaction, and reduced trust. The cultural assessment should therefore become a part of routine nursing admission and care planning. So whenever we are doing care planning, so the cultural assessment is also very, very important in that care planning when we do for the patient care. Then the challenges: the conflict between medical recommendation and cultural beliefs, misinterpretation of patient behavior, strategies, shared decision making, and respectful negotiation. That's why I've already given the explanation about the examples. The strategies, the respectable negotiation has to be there to understand the patient needs. Understanding cultural transforms nursing from delivering treatment and delivering meaningful care. Next, let us see about the global health inequalities and cultural competencies. What is global health inequalities? Health inequalities arise because of access to healthcare is not equally distributed across population. The main one is poverty, education, geography, gender, disability, ethnicity, migration, and discrimination significantly influence health outcomes. The cultural competence helps the nurses reduce these disparities to ensure respectful, inequitable care. So the the inequitable remains one of the greatest challenges worldwide. The cultural competence is a powerful strategy to reduce disparities in healthcare access, the quality and outcome. Then let us see about the health inequalities arise from the differences, how we can manage this. So the people income, education, geography, gender, ethnicity and disability, social exclusion, cultural barriers often worsen these disparities by limiting communication and trust. In that, people living in a rural or remote regions often experience shortages of healthcare professions and delayed diagnosis. And migrants and refugees request frequently face language barriers, legal challenges, financial constraints, and unfamiliar health systems. Indigenous and minority population may distract healthcare becomes because of historical discrimination. So practical, what are the practical aspect in this? The the community outreach program, the nurses, we have to plan about the community outreach program, inclusive healthcare services, health education in local languages, culturally tailored health promotion. The challenges are structural inequalities, healthcare discrimination, and limited healthcare resources. And strategies: equity focused nursing practice, inclusive healthcare policies, and community partnerships. So, in that, we see the equality and equity. What is equity? The health equity begins when every patient receives care that respects not only their illness but also their identity. The nurses play overall, the nurses play a critical role in advocating for health equity, strengthening primary health care, and promoting culturally appropriate public health interventions. Now let us see about cross-cultural communication. What is the cross-cultural communication? The cross-cultural communication is effective cross-cultural communication is the foundation of culturally competent nursing and directly influences patient safety and quality of care. Effective communication includes verbal, non-verbal, written and technological communication while recognizing cultural differences. So in that, we just effective communication, how we can make it. Active participation listening helps the nurses understand patient beliefs and expectation, that we have already learned about the learn model. In that, active participation and listening is also very understand, it is we can understand the patient's expectation and beliefs. And then professional interpreters should be used rather than family members when discussing complex and medical info. For example, when you wanted to reveal some confidential things to the patient, we don't understand the language. The language barrier is there. We will be using the relatives for that. In that sense, there will be a legal issues can happen earlier. So then that's why you have to use professional interpreters should be used rather than family members when discussing complex medical information. Non-verbal and take back ensures that the patient correctly understand medication instructions and discharge advice. Then you have to see the next one is practical application. The practical applications are the interpreter assistant consultation and simplified discharge instructions, visual educational materials, and patient centered conversations. These are the practically when the patient is, we will be discharging, you have to give proper instructions. In simplified discharge instructions can give visual educational materials you can provide to the patients for like a discharge card. In that itself, the follow-up things, you can give the visual educational materials and patient-centered conversations. Then the challenges are language barriers. Again, the same thing, misinterpretation and low health literacy. Then strategies are when the language builds understanding, the trust grows and healing follows. That we all know exactly. We are experiencing every day in the with the patients. When language builds, even you have a proper language communication skills, the trust grows and healing will be easy. The nurses play a critical role in advocating for health equity, strengthening primary health care, and promoting culturally appropriate public health interventions. The next point, let us see the cultural competence across nursing process. So already I have told you the cultural competence should be integrated into every stage of nursing care. And in each phase of nursing process benefits from culturally informed practice. So when you are doing the nursing process evaluation, the history taking, so you have to cultural competence should be incorporated throughout the assessment, diagnosis, planning and implementation and evaluation. For example, an assessment is very, very important. Whenever we are assessing the patient, when the patient comes, you have to identify the language, religion, dietary preferences, family structure, and traditional practices from the patient. So cultural beliefs, language preferences, religious practices has to be understand. When you are the diagnosis when we are nursing diagnosis when we are fixing, recognize cultural factors affecting adherence or anxiety. So that is also very, very important. Then planning. When we start the planning, how we inculcate cultural practices in the nursing diagnosis, the planning, collaborative goal setting, develop goal together with the patient and family. So then we can understand very proper planning can be done. Then it is implementation, respect cultural practices while ensuring evidence-based care. The respectful individualized intervention can be planned. And evaluation, patient satisfaction, that is assess the satisfaction level, outcomes and whether it is care reminded culturally appropriate. So these are the way once we plan it nursing process. So it is a practical application will be very, very easy to cultural to so resolve the issues of cultural competence. So if the practical individualized care plans can be made, family participation, respecting traditional practices. The challenges are standardized care pathways, limited cultural assessment tools. Strategies incorporate cultural assessment routinely, flexible care planning can be done. Then so 5 steps of nursing process we have already discussed. The nursing process become truly holistic when the culture is considered as carefully as clinical symptoms. The next point is ethical and professional responsibilities. Ethical nursing practice requires respect for dignity, autonomy, beneficence, non-maleficence, justice, confidentiality, and accountability. So in that, it is we have to look at. So we know the key points of ethical practices, professional responsibilities are respect of autonomy, beneficence, non-maleficence, justice, confidentiality, and professional accountability. The practical implications are ethical dilemmas, and it is cultural conflict and personal bias. In that, you can just look at the obtain informed consent using language the patient understand. So that is why whenever that nowadays most of the hospital is mandatory, the language has to be made it in the same state language has to be followed. So ethical obtain informed consent using language the patient understand, respect refusal of treatment while ensuring the patient understand the consequences. That is very important. You have to respect the patient, and you have to you have to accept the refusal of the treatment while ensuring the patient understand the consequences, and protect privacy during culturally sensitive examinations. That is also very important. Advocate for vulnerable population facing discrimination. So the strategy is ethical decision making model, institutional ethical committee, and cultural consultation. Professional excellence is measured not only by clinical skill but by fairness, dignity, and respect for every human being. Next, let us see the building culturally competent healthcare organizations. Healthcare organizations building how the healthcare organization should embed the cultural competence into policies, leadership, and workforce diversity, interpreter services, quality improvement, and continuous education. So in that, the healthcare institution should create systems that promote inclusively and equitable care. The key points are diversity in workforce, interpreter services, inclusively policies, cultural competency training, and leadership commitment. The patient feedback system can be used. The practical application, diversity training, multilingual educational resources, inclusive recruitment. The challenges, resource limitation, organization resistance, and policy gap. The strategies we can take about the continuous staff education, quality improvement initiative, leadership advocacy. The cultural competence flourishes when the organization create environment where the diversity is valued, and create environment where the diversity is valued and inclusion becomes standardized practice. The next is future directions, innovations, and global nursing leadership. Already we learn about a lot of innovations in this, but how we can help in cultural competence. The future of nursing combines the technology and compassionate, culturally responsive care. In that, healthcare is evolving rapidly, requiring a nurse to develop new cultural competence alongside technological expertise. The future nursing practice will combine technology with compassionate, culturally responsive care. Emerging areas include, so we have already, the last session, it is already explained about artificial intelligence, telehealth, precision medicine integrated with cultural preferences, global nursing partnership, and climate change and migration related healthcare. So the future nurse competencies, practical applications, virtual multicultural consultations can be done, AI assisted interpretations, global health partnerships, and digital health education. Already we have discussed all these points. The challenges, digital divide, ethical concerns, and technology acceptance. Strategies are digital literacy training, continuous professional development, international collaborations. The nurse of tomorrow will succeed by combining cultural intelligence, technological innovation, and compassionate leadership. So, emerging trends of future directions. And in conclusion, the cultural competence is a continuous journey rather than one-time achievement. Nurses who integrate cultural awareness with clinical expertise, improve communication, strengthen technological relationship, enhance patient safety, reduce health disparities, and promote equitable healthcare. Every patient deserves care that respect their beliefs, values, languages, and identity while maintaining the highest standards of evidence-based care. So, overall, I conclude every patient brings a unique culture, story, and set of values. By embracing the diversity with compassion, respect, and professional excellence, nurses become true advocates for health, equity, and global healthcare transform. And so take the key take home messages. Treat every patient as an individual, not as a stereotype. Respect cultural beliefs while ensuring patient safety. Communicate in a language the patient understand. Use learn model during culturally sensitive interactions. So that is very, very important. So whenever the culturally sensitive interactions comes, then you have to use the key learn model for the culturally sensitive interactions. Cultural competence improves quality, safety, and patient satisfaction. Thank you. Thank you so much.
Thank you, Dr. Srilekha Rajesh ma'am, for this wonderful presentation and for this session. If any of the participants is having any of the queries, they can ask ma'am. She's ready to answer your queries. Any of the participants? Okay, fine. I think no one is having any question to ma'am. So we will move on to the next speaker. And the next speaker is Dr. Deepak Sethi, sir. He is the Dean of Noida International University, Noida.
Good afternoon, all of you. First of all, thank you so much, the previous speaker, Srilekha ma'am, for enlightened us on the topic, and organizing committee for organizing such a novel international conference, especially on the online mode, because that saves a lot of time and constraints. But again, the technical glitch is always be there as we are using a technology nowadays. So without wasting much time, let us come on the topic. So my topic is about the introduction, the role of the WHO, that is World Health Organization, in the global field. So let us give you a brief about the WHO. Though it's not a new topic for the nursing fraternity, everyone has a point of contact with the content of WHO and the policies and the aims of the World Health Organization. So the World Health Organization was established in 7th of April 1948, and we all know that the headquarters is in the Geneva, Switzerland. So total members are 194 members across the world. And I mean, we know very well that our Honorable President of Indian Nursing Council is also a member of a World Health Organization who represents the nursing fraternity across India at Geneva World Health Organization. So a bit about the history of the World Health Organization. The WHO officially established on 7th of April 1948. From 1946 to 1948, it constituted and drafted the members of the state who become a part of the World Health Organization. In 1960, they focused on the controlling communicable diseases, because we know very well there was a time when during late 60s and 70s, when there was no cure for the communicable disease. Like for example, if you take example of a tuberculosis, we know it was supposed to be a deadly disorder that time. But in the later 20th, 21st century, we have also seen the COVID-19 similar way, but though the technology and the medical equipment and the medical spectrum has been broadened its area of concerns. So we got the vaccination of COVID so at the early stage, but it was not same if we talk about the tuberculosis in late 60s and 70s. So in 1980, the smallpox declared eradicated by the World Health Organization. That was one of the first milestone achieved by the World Health Organization in 1980. In 2005, the international health regulations has been adopted by the World Health Organization, and till the present scenario is the WHO is addressing the emerging health threats across the globe and achieving the universal health coverage. We have seen in COVID-19 how the WHO was giving us a census and regularly monitoring the mortality and the morbidity rate across the world. Talking about the constitutions of the World Health Organization, it consists of the WHO believes that we know very well how the WHO explain the concept of health well-being. It's give us a comprehensive and holistic definition of health that includes a complete physical, mental, and social well-being of a person. So the vision and the mission of the WHO is dedicated to achieving the highest possible standard of health for all people everywhere at every stage of life, whether it's a developing country or a developed country, it hardly matters. WHO work together across the world. So the vision of the WHO is the world is in which everyone and everywhere can attain the highest possible level of health and well-being. And to fulfill this vision, there are certain missions are there to promote health, to keep the world safe, and serve the vulnerable group, especially the elderly people. Okay, so the organization structure about the of the World Health Organization, it same as we are having our executive council members in the Indian Nursing Council or state nursing council or in the parliament and all. Similarly, the organization structure of the World Health Organization consists of the World Assembly members, executive board members are there. Around 34 technical qualified members are a part of the executive board of WHO. Secretariat is the head of the director general who look after the entire structure and the hierarchy of the World Health Organization, and the regional offices are there across the world. There are total 6 regional offices to support the countries and addresses the regional health priorities, and it ensures that the coordination technical support implemented the WHO program. So whatever the programs has been implemented across the world, these regional offices are having a they're having eagle eyes on the world. Just for example, the WHO just recently declared the India as a polio-free country. So this is how the regional offices the works. Let us talk about the core functions of the World Health Organization. So the WHO performed the 5 main core functions to achieve its mission and to improve the global health. The leadership quality, it provides the leadership for the global health matters that shapes the health agenda and advocates the better health for all the people. Standard the settings, WHO also work as to establishing some SOPs and the guidelines for the health and make it ensure that the quality, safety, and the efficacy of the health interventions and to promote the best practices in the healthcare areas. Policy development, again, for the various countries is also a responsibility and the core function of World Health Organization. It also provides a technical assistance and build a capacity, transfer knowledge and technology, strengthen the health system in the other states. Like the best example, if I can quote over here, is there are many countries in the United Nations, like South Sudan is there, Lebanon is there, Zuba is there, and many other Middle Eastern countries and all, where the health facilities are not being, properly implemented over there because of their internal conflicts, internal wars between the members of parliament or any other reasons. So in that case, the United Nations, along with the WHO, take cares of these developing and the poor countries so that they can also avail the healthcare facilities with the minimum cost or a free of cost. And the entire funding is done by the United Nations in consensus with the USA and the World Health Organization. I hope just recently, whatever the situation is going on in Lebanon, we know how the funding agencies from the USA has been stopped giving funding to the Lebanon people and all. So ultimately, their healthcare structure is totally being collapsed. So just an example over here, not a part of this topic. So how the World Health Organization system strengthens? So the WHO supports countries, as I just told you, countries in the developing, resilient, inequitable, and the sustainable health system, where the healthcare delivery uh, system and the you can say the treatment modalities are not being easily available to the people. So they just try to deliver the quality healthcare services to all the population. So the key areas of support is health workforce, to strengthen the education, training, and the retention of the healthcare professional, and to promote workforce planning. Again, I just want to put up example over here in United Nation countries like South Sudan, Juba, Lebanon, and all. If you just Google these countries, so these are having a different, primary and secondary level of hospitals are there, and these hospitals are basically taken care by the medical defense medical services of various countries. So especially the Asian countries, like India is also a part of that United Nation healthcare delivery system, where the Indian armed forces, especially the medical and the nursing fraternity, they are being posted over there in the United Nation countries, so that they can just provide them the minimal healthcare facilities. And again, it is again totally funded by the UN and the WHO. So the health financing, just I give example of how the finances are also being taken care by the WHO. Services delivered to the people, those who won't be able to get the services and the facilities so easily. Leadership and governance, again, the WHO promotes accountability and evidence-based decisions taken by the higher authorities or the secretariat of the World Health Organization. Health information system, again, as we are having in India, we are having a LMS system is there, iCloud is there, ERP is there. We know in hospital as well, no more paperwork is going. We are just supporting. So everything is on the digital platform nowadays. Even if it is a doctor's data, patient laboratory reports, or a patient case histories, or a follow-up and all. So similarly, the World Health Organization also established a health information system that will look after the complete census of any threatened or a deadly disorder which is spread across the world. Just we have seen the case during the lockdown period of COVID pandemic. It also accesses the essential medicines and the technologies to promote the equitable access to quality medicine, vaccines, and the medical technologies to the countries where these technologies are not being easily delivered. So the universal health coverage, this universal health coverage is a basic main motto of the World Health Organization to support the global entire world, to ensure that all the people can access the quality health services they need without suffering a financial hardship. Just I give you the example about how the finances of the developing countries in the United Nations is taken care by the WHO. So the key principles are to ensure that everyone has a fair opportunity to attain the highest level of the health without being judged on the basis of their races, their financial conditions, or anything else. The quality care, safe, and person-centered health services should be provided to the people. Financial protection should be given by under the universal health coverage in WHO, and it make it very sure this health facility is given by the World Health Organization or the UN should be accessible to all, so that the ensure accessible and affordable health services. Why I am giving an example of a UN again and again, because my wife is in armed forces, so she's right now being posted over the United Nation for 2.5 years. So just recently also I just came to know that what all kind of medical constraints these countries are actually facing. And we are seriously so lucky people that we are a part of a such a system where the healthcare facilities are developing and accessible to local people in a very good way. In India, government is going to be open many government hospital, like we have seen in the last 10-15 years, many AIMS hospital being established by the government, many healthcare services, and the various utilization of the various Pradhan Mantri Awas Yojana and many other healthcare programs, maternal and the child healthcare program being implemented by the government of India. But these all programs had never been implemented by these United Nations countries. The reason behind their political conflicts are there. But under the universal health coverage, the World Health Organization look after each and everything, whether it's a financial hardship of the medical equipments over there or the healthcare facility accessibility to the people. Talking about the primary healthcare, again, it's a main key feature of the World Health Organization. It's a community-based care to promote health, to prevent disease, and to treat the common illnesses and support overall well-being throughout the life courses. The key features are the community-based care. We know the community-based care, how it helps the community people to utilize the healthcare services, to prevent and promote the services, comprehensive and integrated care that includes your mental, physical, and social needs across all ages, especially the geriatric care. Equitable and the people-centered care should be there. Empower communities. Empower community means there are many services which the government can implement in the community areas, but just every time giving the services to the community area does not make sense. So under the primary health care, the WHO also aims to strengthen the people, those who have a caliber to take care of others as well. Just a small example, if I give you over in India, we're having a CHC, PHC, and sub centers are there. Then we have ASHA worker and ANMs. So there is a series of hierarchies is there in the healthcare sector in India. Similarly, the WHO take care of strengthening the people in the various community areas so that later on they can just take help of them to deliver the services over there. Disease surveillance is, we have seen in COVID pandemic, how the surveillance of the COVID pandemic about the mortality and the morbidity was taken care of World Health Organization and the ICMR India. Every day we are getting the bar got raises if you talk about the mortality and the morbidity COVID-19. So these census were looked after by the ICMR India, and later on the data was submitted to the World Health Organization. The World Health Organization collected the data globally and then dismantled it around the world. So the key objective was to detect early detection of any threatened disease, though it fails if we talk about the COVID-19. But yes, the main target is to detect any outbreak of any pandemic or any epidemic around the globe. The trend monitoring track diseases pattern and global trends, how the disease is prevailing. Just recently, I just came to know that few COVID cases are again, coming up in few regions of the India. So these sudden, eruption of any threatened disease just make the WHO, sensitize about the monitoring of outbreak and the global disease trends. Risk assessment, again, assess the risk of the disease spread and the severity, how the severe the disease is. Inform the evaluate public health actions and control and prevent the disease spread. They just give you a standard SOPs and certain protocol, like we have seen in COVID pandemic. Like many protocol, many things are there we are having through the government of India. Like just small is to wear a mask and use of sanitizer frequently and all. So these SOPs are again a part of the disease surveillance taken care of by WHO. And if you talk about Indian scenario, taken care by the ICMR. The global collaboration, again, we know very well nowadays the collaboration and the MOU signing is one of the best key feature of connecting one country with the other country. So WHO also take care that the developed country make just join hands with the developing country to provide their best medical services in case of any pandemic. So, communicable disease control is again, I just give you example. The main key feature of WHO to control the communicable disease, because this is the only thing which we cannot control. If we compare the COVID-19 and the HIV/AIDS, the major cases we have not seen in HIV/AIDS. The mortality rate is very much not that much severe as compared to COVID-19. So communicable disease control is one of the key feature of WHO, that they are very sensitive about that. Example, tuberculosis, HIV/AIDS, malaria, hepatitis, and there are some neglected topical disease which is not being explained much on internet and all. One of the disease just recently I have heard about, the monkey pox, something is there. Few cases in the Africa and all, they have seen the monkey pox and all. So these are the neglected topical diseases which may prone to come in the other countries, during the migration of people from one place to other place. Yes, the polio eradication initiative, again, it was taken by the WHO only. The Global Polio Eradication Initiative is a public-private partnership led by the national government like India and supported by the WHO, UNICEF, Rotary International, and the CDC and the various vaccination alliance. They all together join hands with each other, and finally they have eradicated the polio throughout the world. The best example, I can quote over here, that how the WHO take care of our health day by day. Again, the immunization program is also a universal immunization program. We know it was initiated by the World Health Organization. Right now, it's termed as expanded program on immunization because they have added many other deadly diseases, though it is not mandate to put in the EPI, but it's choice based. For example, varicella zoster, or you can say your cervical HPV vaccinations and all that. These are the choice based vaccinations that people can take on their priority basis, whether they feel it to take it or not. So the key objective are the universal access. The people should access all the vaccinations of the deadly diseases free of cost. Disease prevention, strengthen the system, vaccination promotion, equity, and the inclusion, so that not a single person living behind without vaccination comes under the expanded program on immunization. So it's again responsibility of the World Health Organization to take care of the EPI implementation across the world. What about the non-communicable disease like cancer, diabetes, CVS, and prevention strategies to prevent all this non-communicable disease? Again, WHO is not only take care of the world this communicable disease, but they're also responsible for certain non-communicable disease, especially those who are contributing a lot in the mortality, like cancer, we know very well, diabetes, and the cardiovascular diseases. So whatever advertisements on the TV, movies, or some of the OTT channels and all, we can just see to prevent cancer, diabetes, and to prevent the cardiovascular disorders and all. These all advertisement and the preventive measures are governed and declared by the health ministry with consensus with the your health, we can say the ICMR guidelines and the SOP given by the various healthcare agencies, including World Health Organization. For example, tobacco use, unhealthy diet, physical activity, overweight, obesity, and many more. But not all the other babas and all are part of these protocol and the SOPs. Like we know very well nowadays on the Instagram and all, we have seen many babas are come over there with their certain ailments and all to prevent cancer, diabetes, and all. Though it's a part of Ayurvedic treatment and all, but yeah, we can say it's also a certain kind of preventive strategies, but not at all looked after by the WHO. So Moving further, yes, mental health initiative is again a very important aspect nowadays that WHO is looking after, because today is a corporate world, and the corporate world, whether if we talk about an education institute like universities or any kind of multinational companies, and all, the mental health of employees should be taken care by the healthcare organizations, because WHO work with the countries and partners to promote the mental well-being and prevent mental disorders, to ensure the access to quality mental health care for the whole. So key initiatives are to promote the mental well-being and the resilience, uh, prevention of mental disorders by early detections, ensure equitable access and affordable quality mental health care support services. This is the main thing actually, because before having any mental illness and all, the support system should be there. And those who, the nursing fraternity, those who are over this Zoom meeting, those who belongs to a university or any big organization, you must know that nowadays all the accreditation body make it very mandate that the organization should have a counselors and the psychiatrist in their department and at the central level, so that the counseling sessions regularly, mentoring sessions of the students and the faculty member should be taken care of, because this is the only thing which people feel like it's a taboo on us. We ashamed to go to a psychiatrist or a counselor to declare that yes, I am having such a kind of depression or such kind of stress over my, because of my personal things. So access to care should be there. Again, the policy and the legislative laws should be implemented, because we know that being a mental disorder, having a person, it's a taboo nowadays. I mean, people treat like you a psychiatric patient. So just to remove that taboo and all, certain laws and evidence-based policies are made by the World Health Organization, and since system strengthen the system and integrating it into the primary health care. So the psychiatric counselings and the mental well-being is integral part of a primary health care system, where on the initial stage the people, faculty, student, fraternity can uh, can take help of a counselors and all to promote the mental health well-being. Yes, very important. How can we neglect the maternal care? So the World Health Organization, we know we are having lots and lots of mental health and child care program in India as well. So how come the WHO, get restrained from that? So to ensure the safe pregnancy and the quality antenatal care, reduce the maternal mortality is one of the main key feature of uh, World Health Organization. And in India, if we talk about the many of the organization, the Union Ministry of Health, whether it's having so many maternal and child healthcare programs are going on, in India, just to support the safe pregnancy and to minimize the maternal mortality rate, especially this, the stillbirth and all. Antenatal care should be regularly given, and emergency services and all. Again, just I told you about the maternal and the child health. Again, a key feature of improving the child health and to build healthy communities and achieve a sustainable development. So we have integrated management childhood illness. This we all have studied in pediatric nutrition, to promote the nutrition of the small kids. We are having many program, and the Anganwadis midday meal program, midday meal programs have been utilized by the rural community people. Vaccinations, again, child survival programs are there. So many initiatives are taken by the ICMR India and the World Health Organization to take care of maternal as well as the child health. Obviously the child are the future of the nation, so they should be taken care along with their mother. Moving further, nutrition and the food safety. Again, we're having lots and lots of nutritional deficiencies nowadays, especially in maternal and the kids. So making it very sure that the mother and the child should get the nutrition in a proper way. So this many nutritional program like anemia control program, and many other program. won't be able to recall the names of programs and all. So many programs have been implemented by the state government and the national government to promote the healthy nutrition and the food safety among people, to minimize the malnutrition and the promote healthy diets, food safety insurance, and whether it's hygiene or providing the multivitamins or the minor minerals and the elements to the people, like folic acids and all, during the pregnancy and all. Yes, emergency preparedness, we know nowadays, I mean, we cannot, life is very uncertain, so we cannot expect the next moment what will happen. So we know we are all are living in a era where the natural calamities and the disasters may happen anytime. We have seen many cases of earthquake recently in the Philippines. There was a very massive, earthquake came at this Richter scale of 7.8 that actually shattered the life of a people over there. The building was collapsed like anything. I mean, people just died. Even the school buildings collapsed. Many small kids have been died and all. Having this floods and all in India also, we have seen the scenario. So the emergency preparedness is again a responsibility of the World Health Organization. See why, as my topic is about the role of WHO in a global area and all, but don't forget that the whatever WHO is implementing, it is implemented at the WHO headquarter, and later on it will be dismantled across the world, their local agencies and all. Like in India, we talk about the ICMR and all. So then further the secondary, this hierarchy they will follow, and furthermore the whatever policies and SOPs made by the World Health Organization and should be implemented across the world in different countries and then further states and all. So what emergency preparedness talks about, we all have studied in emergency care, in adult health nursing. Risk assessment is there, disaster management should be there, health responses, the ensure rapid, equitable, and quality health services during the emergency. Humanitarian action should be there, providing life-saving assistance with compassion and the dignity and respect of affected population. And finally, the collaboration with the other NGOs to give them some fundings and all to safeguard people life and all. WHO response to COVID-19, we all have seen that WHO is the leading coordinator in the global response to the COVID-19 pandemic to save life, protect people, and minimize the impact of societies and economies. We know that the economy also got affected very badly across the world due to the COVID-19. So this is again, WHO played a very important role that time as well, to give us a standard guidelines and all, what to do, what not to do, because the COVID-19 was very new to us. We do not know what are the consequences of getting this respiratory illness, and we have seen even after getting the vaccination and all, many people died because of the secondary side effects and all. So all these things WHO take care very carefully, followed by the local agencies of the various nations like ICMR India. So they develop and update the evidences and all. Surveillance, we have seen the surveillance, the census came to the screen of a television every day about the mortality and the morbidity rate across the different states, areas, and the cities. Again, the vaccinations, though the vaccination was developed by the Serum Organization Pune so early, and we know that they have bypassed many randomized control trial phases, because it's not easy to get the vaccination into the market without being having a proper all the 4 phases of the RCT and all. But though it was a time need based vaccination, and so the WHO again gave the approval to launch the vaccination, though the the evidences that it is actually being cure the COVID-19 symptoms, the WHO gave the approval, even though the actual objective of implementation of vaccination was not at all being proven clearly that time. but we cannot say, they are the culprit. It's all about, if the vaccination was not launched within the particular time, we know the mortality rate was something else. So it's about the, and again, the last, the research and the evidence-based practice. The WHO believes in the research and whatever researches are going on across the world, especially on the deadly diseases like cancer and HIV/AIDS. They have a close monitoring about these researches and what actually coming in the market. About the nursing profession, if you talk about, yes, WHO is also developing the competency in the nursing leadership and all, uh, expanding the nursing workforce competency, enhancing the skills, knowledge, and the professional competencies and all. Nursing leaders and the quality care should be given to the nursing students so that they get trained nursing fraternity in future. That is the reason in the late 90s session, we all learned the intramuscular injection on on the pillow covers and the cushions and all. But nowadays the trend has changed. The competency is much more skilled. We're having a high fidelity mannequins and all. It is a very good example, how the nursing profession is going to be having a more skill as compared to the previous one, because they can, in the laboratory even, they can just feel the livelihood of the patient on dummies and all. That much actually, the high fidelity mannequins, they can just feel the patient without going into the hospital at the initial stage. Current challenges about the WHO is the antimicrobial resistant threats are there. So AMR is not being introduced much in India, but yes, antimicrobial resistant threats are there. People who are continuously having antimicrobial treatment, they got resistance to particular antibiotics and all, and then later on it won't give them the optimum results. Climate changes is again a very a very certain challenge for the World Health Organization, because climate environmental changes impact health a lot. We know very well. We have seen the current scenario in India where the global warming has reached up to the threshold. We can see the temperature reaching to 48 to 50 degrees Celsius at Delhi NCR as well. So these are the things which actually WHO cannot resolve it, because nobody can control the nature. Inequalities, health disparity within the across the country hinders the progress towards health for all. So inequalities means, though in India the government has never become biasness show the biasness among the people. That is the only reason that the government is back to back establishing the government hospitals for the people, those who cannot able to afford the corporate treatments and all. So in India we cannot say it's a much biasness among the people, if you talk about the sharing of the health modalities and the treatments. But yeah, there are many countries like African countries are there where they are judged on the basis of the races and all. So it's again giving a very good, very challenging threats to the WHO. And finally, the emerging infections are there. We have seen COVID-19, and we do not know actually what will be coming in the upcoming years in the world. So WHO is always, have their ears get sharpened to face any kind of this kind of challenges like we have seen 3-4 years back during COVID pandemic. So the future priorities are the digital health preparedness and the equality. Digital health, as I told you, nowadays we're having a digital health in our hand. If somebody want to access any doctor or any treatment, in every the facilities is available through your phone. Just one finger apart, we can easily access the health facilities. Preparedness, strengthening the health system, emerging the readiness, and to make the healthcare delivery system and the fraternity much more equipped in these skills, like how the nursing fraternities are getting a better skilled workers nowadays. And finally, ensuring the inclusive and the equitable health for all without being judged on the basis of their caste, religion, or the color and all. So it's all about the presentation. Thank you so much. Any doubt you can ask me. I am really extremely sorry for my video is not being properly delivered to you people. I really don't know what is the reason. uh, I think my computer doesn't like my face. That may be a reason. Anyhow, thank you so much once again. Any doubt you may ask me. Over to the MC.
Okay, thank you, Deepak sir, for this wonderful presentation. If anyone is having any questions, so they can ask sir.
I wish they are listening the session online because we know how the online sessions being delivered and used
Yes,
by
sir.
the faculties and all. So I request all the participants to ask questions. So just let us make the sessions more interesting. Otherwise, the speakers also feel bored. They're talking in front of a PC and all without having in between sessions. You must ask them questions in between as well. I must tell you, during the PhD sessions and all for the international student, there are so many questions, and we never felt like actually it's a online session for them. So always try to mingle up in the sessions and all. Anyhow, yes, it's over to you.
So anyone is having any question, or else we will move on to the another speaker of the day today. Okay, fine. I think you people are not having any other questions to sir. So we will move on to the another speaker. The another speaker is Dr. Anu Gaba, ma'am. She is the Dean of Department of Nursing, GD Goenka University, Gurugram, Haryana. Ma'am, are you available?
Very good afternoon.
Good afternoon, ma'am. How are you?
I'm good. I'm good. Okay. Shall we start?
Yes, ma'am.
Okay. I'll share my presentation. Wait. Is it visible?
Yes, ma'am. It is visible.
Yeah. So, a very good afternoon to one and all present here today. So, it's an immense pleasure to be a part of this event, and many congratulations to all the organizers, the whole organizing team for the successful of conference. Okay, my dear friends, so today we are going to discuss regarding the advocacy and policy development. My slides are changing?
Yes, ma'am.
Yeah, okay. See, we all are healthcare professionals, right? And we know that, we know that what is the importance of equitable distribution of health services, what is the importance of focusing on the patient outcome, what is the importance of to focus on the healthcare delivery system. We knows each and everything, but the most important thing is, like, as a healthcare professionals, what is our role? Why there is need to involve the nurses in policy making? What is the difference between advocacy and the policy development, right? See, I have, attended so many board meetings, or I can say that I have attended so many panel discussions where every person, every healthcare professionals, they discuss regarding the advocacy and policy development, right? We discuss a lot, but the most important thing is implementation, which is still pending, which is still required in healthcare delivery system, right? Every nurse wherever she's working, whether she's working in a private sector, whether she's working in a government sector, right? Whether she's a clinical nurse, whether she's working in occupational therapy area, or whether she's working in industry, wherever she work, right? Every nurse has the capability, or I can say that she's capable to work or to collaborate with the healthcare professionals, to collaborate with the policy makers. And you know why the nurses should be a part of that? Because nurses, they are everything for the healthcare delivery system. They are sweat, blood, everything in healthcare delivery system. And it is very much required that nurses has to be involved in the policy making, which is very much required. Now, see, nowadays we talk about the universal health coverage, we talk about the SDGs, right? But my dear friends, I would like to ask you a single question, right? Without involving the nurses, how can you achieve the goals? Nobody can achieve the goals without involving the nurses in their work, without involving the nurses in that particular plan. So I think it is very much important that nurses has to be a part of policy development committee, so that something come up, like something has to be come up for the nurses and they can do wonders in their field, right? Now, if anybody asks you what is advocacy, what is the difference between advocacy and policy development, I can say that advocacy gives us voice to health needs, because as a healthcare professionals, nurses know what are the health needs of the individual, what are the healthcare requirements of the patient. And if nurses knows that, then definitely they help those needs. They can transform those needs into action, or I can say that they can implement, actually they can do some implementation in the clinical areas, right? Now, why the advocacy is important? See, I think COVID-19 has explained us everything, where actually we stand, where is our healthcare delivery system. Everyone knows that. So many nurses have lost their lives. So many nurses have lost their, family members. They even didn't went for the cremations and all. And the nurses who are working in the clinical areas, they have faced a lot problems and number of problems, starting from shortage of supplies. Minimum resources are there. It's difficult for them to work in that area. It's difficult for them to handle the mass casualties, right? Then see, if you're not able to handle the mass casualties, obviously there will be a psychological stress in your mind. What is my role? What I am doing here, right? Why, see, I'm on the duty and everyone is losing their life. So what is my role? I don't know how to work. So you will lose your confidence too, right? Another thing, there are n number of patients, the nurses available, there is shortage of nurses in that particular area, in that particular field. So what happens? There is a physical exhaustion, you feel tired. So because of tiredness, you are not able to provide a quality services to the individual. So I'm not saying it's your fault. No, it's not your fault. But because of tiredness, because of exhaustion, because of anxiety, because of stress, you're not able to provide actual services to the individual, actual services to the patient, right? Then if you're not able to provide actual services to the individual, obviously the patient outcome will decline, right? So a lot of things are associated with that, right? Now, see, if you're working in an area, I think we all are professionals, right? You might be nurses, you might be working in academic field, right? So when we are working in our areas, a lot of people are working with us. We are working as a team. But my dear friends, there are cultural barriers. For example, I'm going to share one example with you. I'm uh, dean in Department of Nursing, right? But the people who are working under me, they are from Manipur, they are from Haryana, they are from Himachal, right? They are from UP. So everyone belongs to different areas, right? So cultural barriers are always also there. But as a leader or as a nurse, I think the person should know how to handle the situations, how to manage the situations, right? Now, there are reporting barriers also. To whom shall I report? Shall I report to the principal, or shall I report to my department boss, or shall I report to the HOD? So a lot of barriers are also there, right? Now, the most important thing, when we talk about the public health care, when we talk about the public health sector, my dear friends, there are many challenges in public health sector. many challenges in public health sector. So I think the nurse, they that is why we can say that the advocacy has to be there, because she knows where are the challenges, how to sort out those challenges, how to manage those challenges. So that is very much required. Another thing, there is lack of training in many areas. Nurses are working there, the scenarios has changed. We are in 2026, where we talk about AIs, where we talk about artificial intelligence in research, where we talk about artificial intelligence in writing the manuscript, where we talk about the use of technology in assessing or diagnosing the patient. But my dear friends, where are the training sections? Nurses needs training, they needs training. If you are not able to provide training to the nurses, then there is no sense of advocacy, right? So nurses needs actual training wherever they work. Even the community health workers also, they need actual training to work in that sector, right? There is lack of recognition. I think everybody will agree with me, lack of recognition is everywhere, right? For example, I'm giving you small example, right? um, 2 days back, I went to one school for this HPV vaccine. There is HPV vaccine mission, which is initiated by Government of India so that we can reduce the cases of cancer. So I'm a part of that HPV vaccination campaign. So 2 days back I went to one school. So the 2-3 teachers were there. They are very active, very active. They are continuously, they are motivating the girls to go for the HPV vaccine. They are encouraging them. They are counseling their parents also why it is important to go for HPV vaccine. Rest of the teachers, they are very lethargic. They are okay with that. कोई बात नहीं, ले लिया इंजेक्शन तो ले लिया, क्या फर्क पड़ता है, नहीं लिया तो क्या फर्क पड़ता है, हम भी तो ठीक बैठे हैं, हमें कुछ हुआ है क्या? So their thought process is like that only, right? But the two teachers who are actually putting efforts to motivate the students, who are actually doing counseling to the parents as well as to the kids as well as to the girls, right? None of the management has recognized their work, right? So there is lack of recognition in our field too, right? Now, why nurses must be policy leaders? Why the nurses has to be a part of that policy making committee? Why? The most important thing, nurse, the largest healthcare workforce. Obviously, we are, without us, nobody can do anything, right? Without us, you can't even assess the patient, right? Without our presence, none of the doctor can touch the female patient, right? Am I right? So we plays a very important role in the field of healthcare sector. So I think nurses, they knows that they are in very close interaction with the parents. They have close interaction with the patients and their families. They know what are the needs of the patient, what exactly patients requires. If patients makes facial expressions also, why he or she is making this expression, something is there. He or she might be feeling uncomfortable, right? So this is the strength of nurses. They knows each and everything. Even a simple deviation in patient, she can able to assess, yes, this is happening with the patient, right? So without nurses, you can't do anything. So why can't you involve? That is why the nurses has to be a part of policy making committee, right? Nurses, they are experts in evidence based practice. They know how to work in the areas. They know, if I'll do this, the patient's condition will improve. If I will do this, the patient condition will deteriorate, right? So their expertise, they have a expertise in evidence based practice, so they have to be a part of that committee. Now, if we talk about community, nurses are totally involved in the community health centers. The nurses, the community health nurses, the public health nurses, they're totally involved in the community. They are engaged in the community. So they know where the actually services are required, where the services are not reachable, right? This is the area where we need more attention, right? where are the resources, where the resources are less, where the resources are more, how to approach, where to approach. So they knows everything. So that is why they has to be a part of that particular committee. Then leadership in health promotion. Yes, now in 2026 we never talk about treatment, we talk about the promotion, health promotion. We want to promote the health of the individuals rather than immediately jump on the treatment, right? So they are the leaders, they are the leaders of healthcare delivery system, so they has to be involved in that, right? Now, nurses role in policy development. Yes, I have shared with you, like they actually they are worked closely with the patient, right? So they knows that, like what is actually, what are the patient's need, how to work with the patient, where the resources are more, how to use those resources. If the resources are less, how to work with that minimum resources. So they know everything. If you involve, if the policy makers involve the nurses in making the policies, definitely they will help the healthcare team members to implement those policy in their area, right? See, my dear friends, I think you might be agree with my point that it's very easy to make a policies. 1 घंटा मीटिंग करेंगे, हम कोई भी पॉलिसी फ्रेम कर सकते हैं, बट व्हाट इज द सेंस इफ यू आर नॉट एबल टू इम्प्लीमेंट दैट पॉलिसी इन योर एरियाज, राइट? हम बहुत सारी रिसर्चेस करते हैं, विल डू एन नंबर ऑफ रिसर्चेस इन आवर एरियाज. Our BSc students are doing group researches, our master students are doing individual researches, our PhD scholars are doing research for four years, right? They are collecting the data from more than 300 patients, 400 patients, more than 500 patients. But if you are not able to implement that outcome in your area, then it has no value. It has no value, right? Just for the sake of degree, just for the public paper publication, you are doing the research. It has no value. So if we really want to do something in the healthcare sector, if we really want to, raise the standard of healthcare delivery system, it is very much required that nurses has to be involved in the policy making committees. So they will implement that thing in their areas, right? Then they can work in a collaboration with other healthcare team members. They can be a part of decision making team, right? They can take decisions for their patients. Then later on, we can assess what are the policy outcomes, whether we are able to achieve our goals or not. So we can assess accordingly. Now, what are the challenges? My dear friends, it's very easy to say, but there are n number of challenges. The very most important challenge, lack of knowledge. We are we are masters, nurses are doctorate nowadays. Most of the nurses, they are doing PhDs, right? But somehow we are running behind the degrees only. मुझे masters करना है, मुझे PhD करना है. I want to go for government job. We are just running behind the degrees and behind the organizations only. मुझे यहाँ job करना है, मुझे government में जाना है. We're just running behind that. But actually, there is lack of knowledge. Lack of knowledge in both the sides. Lack of knowledge in nurses also, because they don't know their power, right? They don't know their power, how much they are powerful. If you know your power, if you know you are actually worth, no one can put you down wherever you work, right? This is the thing. And if we say about lack of knowledge, the lack of knowledge among policymakers also, because they think that nurses are, they don't know nothing. They don't know how to manage the patients. The doctors are there, they are following the orders of doctors. No, you didn't create any policy for the nurses where the nurses can work independent. You can see abroad, nurses are independent practitioners. I'm sorry to say that, my dear friends, we have started independent midwifery practitioner course. We have started NPCC course. But what is the purpose of that? The students who have cleared NPCC, the students who have cleared independent midwifery practitioner. I know n number of students. The NPC students, they told me, ma'am, we have done NPCC. This was told to us. We can work independently in the critical areas, but no one allows us. If we'll do that, the doctors, the HODs over directly, they will say, if anything happen, you will be the responsible. You will be responsible for patient's loss, right? Ma'am, where are the laws to protect us? There are no as such laws for the nurses, right? So I can say that if we talk about lack of knowledge is on both the sides, among the policymakers also, who are not involving the nurses, and among nurses also, who always feel like they are just below the doctors. No, we are not below the doctors. We are working as a team with the doctors. Without us, you can't do anything. So doctors, everybody needs nurses to work. So we are working collaboratively with the healthcare team, right? Now, heavy workload. Yes, very true. I think everyone will be agree with me. Every student wants to go abroad. If few students are here, they want to opt for the government job. You know why? Because there is heavy workload in the areas, in the private sectors. If we talk about private super specialty hospitals, the strength of nurses are less. They have resources. They have resources in private sector, but the strength of nurses are less. Now, what to do? One nurse, they are taking care of 10 patients in ICU or more than 10 patients in ICU, wherever the scenario is what 1:2 or 1:1 maximum, but she used to take care of everybody. So workload is very heavy in areas. Organizational barrier, I have already shared with you. You are the nurses, these are your job responsibilities, you have to follow these guidelines. If you will do anything else beyond that, you will be punished or you will be fired from the job, or you will be responsible for all these things. So organizational barriers are there, right? How you have given, how dare you have given a tepid sponging to the patient? Did I mention something in the papers? No, I didn't mention. So how can you do that? So there is a lot of barriers. Nurses, most of the nurses, they knows that how to work, how to handle the patient. Even the students also, I'm telling you, as I saw, few of my students are very smart. They can immediately assess, ma'am, patient condition is deteriorating, so I think something might be happening within 1 or 2 hours, right? But because of barriers, they are not able to do something. So organizational barriers are there actually. Now, public perception. So you can't change anyone's thought. Nurses are totally dependent on doctors. Nurses को क्या आता है? कुछ नहीं आता है. Nurses follow the orders of doctors, right? So we'll directly go to the doctor. We'll ask the doctor, how is my relative? She is fine. He is fine, right? Once the doctor will say fine, we are okay. If the nurse will say कोई जरूरत नहीं टेंशन लेने की, she is perfectly fine, अभी हम डिस्चार्ज कर देंगे, इसको कुछ नहीं आता है, इसको कुछ नहीं आता है, तो नर्स है ना. So the public perception is there. You can't change anyone's perception, right? I'm telling you, we are in 2026. We are talking about AIs, but we can't change individuals. Many of the people's, I can say that the community's mindset, communication gap. There is communication gap, right? It might be possible. My team is not able, we are having a 10 member in our team. I'm giving you example. 10 member in our team. I have communicated to one person, kindly convey this message to everybody, right? Tomorrow we have to go to clinical area half an hour before, so that student will reach on time in the clinical areas. It might be possible she has given this message to 2 people or 3 people, but rest of the people are unaware about that. Then what is happening? Everything will be delayed, right? So communication gaps, communication barriers are also there. Second thing, हमें एक दूसरे के साथ होड़ है आगे बढ़ने की. आई एम परफेक्ट, आई नो एवरीथिंग, इसको कुछ नहीं आता, ये अच्छे इंस्टीट्यूट से नहीं पढ़ी हुई है, she don't know how to work in the areas. मुझे ज्यादा एक्सपीरियंस है, आई एम एसोसिएट प्रोफेसर, सो आई नो बेटर देन असिस्टेंट प्रोफेसर, आई नो बेटर देन ट्यूटर. असिस्टेंट प्रोफेसर कहेगा आई नो एवरीथिंग, I knows everything. You are a tutor, you don't have any knowledge, your experience is less, you will learn later on. So why should I communicate everything to my tutors? No, I'm assistant professor. You have to share each and everything to me because I am senior to you. So a lot of chaos are there. So because of that, there is a communication gap, right? So this is the biggest challenge I'm telling you. Now, see why the nurses are involved in advocacy and global health. Nowadays we talk about universal health coverage, we talk about SDGs. So if you will not involve the nurses in policy making, then nothing will happen. Nobody will achieve the goal. So for achieving the healthcare sector goal, it is very much important that nurses has to be a part of that, right? Health equity. There is inequitable distribution of health services. बहुत एरियाज हैं जहाँ पे सर्विसेज पहुंचती ही नहीं है. So if you will involve nurses, they can assess, they can find out those areas, and they can able to provide services to those areas. We are talking about patient outcomes. We are talking about patient safety. So where the patient safety and outcomes will exist, it will exist. Yes, it will exist. But for that, the nurses has to be involved. You know why? Because since morning till evening, 24 into 7, the nurses are with the patients. So they are focusing on outcomes, patient outcomes. They are focusing on patient safety. So that is why nurses has to be involved. Pandemic preparedness. Yes, anything can happen anytime. I think the COVID-19 has given us a very good lesson that anything happens at any time. कुछ भी कभी भी कुछ भी हो सकता है, कोई भी बीमारी आ सकती है. So we should be ready for that. The healthcare delivery system, the healthcare sector has to be ready for that. We have to be pre-prepared for that. And for that, nurses should be involved in that. If you will not involve the nurses, how you will manage? You will not even able to manage the resources also. So nurses has to be a part of that. So here I am going to conclude the topic, my dear friend. See, advocacy is not an option. It is a professional responsibility. And as a nurse, we all are responsible for that. We are responsible for our nation. We are responsible for our healthcare delivery system. We are accountable for our services, right? So I think every nurse should know that how much powerful she is or he is, and we have a capability to go for advocacy, to think on that, and to come up to transform that basic needs into a policy, right? And if we are able to do that, I think we can do wonders. We can do wonders. We are ready for everything. We are ready for even attending the mass casualties also. We are able to provide services to every area, so there will never be any inequitable distribution of health services. So my lesson to everyone here is, every person who is attending the event is right. You all are capable. You are very smart. Nurses are very smart. They're capable enough. Don't put your image down. Never put your image down, right? So whether you are BSc, whether you are MSc, whether you are PhD, whether you are postdoc, you all are capable, and show your strength to your areas wherever you work, right? And one more thing, my dear friends, see, according to me, I can say that, every individual is not perfect, right? Individual differences are always there. So everyone is having weaknesses and strength, right? Try to make your weaknesses, try to convert your weaknesses into your strength. If you will do that, you can do wonders in your field. Thank you so much for the patient listening. And if anybody is having any question, the platform is open for discussion. Thank you so much.
Thank you, Anu ma'am, for this informative and excellent session, ma'am. Because day by day in nursing, like many things are coming. Okay. Yes, ma'am. Like every hour, not every hour, we can say every second we are getting some new researches to be done from the researchers and all. And the thing as just we are academicians, so we won't do much more work on that for the clinical based thing. And those who are connected to the hospitals and all, they used to get involved, all those kind of things. So even I for being as a nursing professional, even I also want to just request everyone to just try to get all the things to be evidence based for the students also. Because nowadays, ma'am, these Gen Zs, they are not at all ready to study. They are not willing to evidence anything at all.
But I'll tell you one thing. They're very smart. They're very creative, right? You give some scenarios to them. They are come up with those solutions. You never think about that. So I usually did this thing with my students only. I'll give them scenarios to them. See, this is the patient. Now you tell me what to do in that case. So students, they're very creative. They're come up with lot of things. Ma'am, we need to handle the patient like that. Ma'am, we need to handle the patient like that. They're come up with lot of things. So I think when you will give them the freedom to work, actually, so they can do wonders, right? And one more thing, my dear friends, never think that like you are 40 years old or 30 years old, or you're having the 20 years of experience or more than 20 years of experience and you have learned a lot. No, not at all, right? Try to brush up your knowledge. There are n number of trainings. Try to go and attend the trainings, right? Brush up your knowledge. If you are able to brush up your knowledge, then you can stand with the Gen Z. I'm telling you, I'm doing that. I'm always, I'll spend some daily, on daily basis. I usually my the class timings are in our universities from 9:30 to 4 o'clock. That's it for the students. And then my students, what usually I plan their classes from 9:30 to 3:30. So half an hour is my time only. So I usually sit with the students, I'll talk to them what you've done in your clinical areas, what you have done today. So students are so much smart. Some of the students, they are saying, ma'am, this is the thing which is not good in that area, they need to focus on that. So what I did, I said, okay, no problem, tomorrow when you will go, you will talk to the HOD in ICU, so you convey your message to them. Ma'am, wo to fir डांटेंगे हमें. Then I said, no, nobody will scold you, no one will scold you. You show your concern to them, like I am concerned about so and so patient, so that is why I'm saying this has to be done in the ward, right? So when you will give freedom to the Gen Zs, and when you actually brush up your knowledge, train yourself according to the scenarios, I'm telling you, you will be a biggest support to the Gen Zs. They will come to you, they will talk to you, they will ask some suggestions from you. Ma'am, this is the thing, can you suggest us what to do? But if you will not brush up your knowledge, if you will not train yourself as per the current scenarios, as per the technologies, I'm telling you, they will never come to your office. They will never even interested to talk to you. The thought is in their mind only, she is old. She's having so many years of experience. She don't know anything. She just come in the class, took our classes, half an hour पढ़ाती है और फिर चली जाती है. That's it. They will never give respect to you, right? So brush up your knowledge.
Thank you, ma'am. Because sometimes it happens, no, ma'am. But with
Yes,
all, like
yes.
all the members, not especially
Yes,
with me, like
yes.
it happens with everyone.
Everyone, yes, yes, yes.
So anyone is having any question from ma'am, they can ask ma'am. Not even only to ma'am, even to Deepak sir is also there, and other like nursing personals are there. And like everyone is very much senior to me. I can say this thing. I am very much junior to whosoever are present over here. But I would like to thanks to my team and the GIR Foundation that they have given me opportunity to like get connected to you people for all the special nursing personnel. So before winding up the session, I would like to announce the result of the paper presentation. So at least we can congratulate them in front of everyone. So at least they should also feel very good that they have got this thing. So yes. So for the today's for the paper presentation, winner is Geeta Mohan. The first winner is Geeta Mohan ma'am, and the second winner is Dr. Roma Patel and Shobna Gangadharan, and the third paper presentation winner is Russell ma'am. And for the poster presentation winner, the first winner is Shalini Deshmukh ma'am, and the second winner is Dipanshi Chaudhary ma'am, and the third winner is Fatima Aju ma'am. So are you available over here, everyone? Is everyone is available over here?
Yes.
Okay, ma'am. So if you people are available over here, so like I would like to just congratulate you people that you people have won the first, second, and the third prize for the paper and for the poster presentation. So whosoever is present over here from the paper and the poster presenters. So Geeta Mohan ma'am, Are you available?
Hello, ma'am. Yes, ma'am. I am available. Good afternoon.
Okay, congratulations, ma'am, for being the first winner of the paper presentation, ma'am. So
Yes,
just,
ma'am.
I would like to ask you to just share your views regarding this, ma'am, for these conferences and all, ma'am.
Yes, ma'am. Very good afternoon to GR Foundation and the conference attendees and the organizing team. I'm so thankful. And 2 day session, I was completely sitting and watching you all. And the paper presentation was well organized. 2 days, it was very happy to listen to so many questions from different jury members and the presenters, whomever presented. They given a really tough competition. And thank you for the patience listening all our topic. And I also thank my institute, AIMS Gorakhpur. On behalf of them, I have represented my institute. So I'm thankful to my institute administration for giving me the academic leave and my department. And the special credit goes to my guide, Dr. Vinod R, Community Medicine Department Assistant Professor. He is the one guide for this research project. So thank you to all, really, and all the participants whomever participated in the presentation. So to them also, congratulations. And special thanks to GR Foundation for this organization. Thank you so much.
Thank you, ma'am. And the second winner is Dr. Ruma Patel and Shobna Gangadharan, ma'am.
Yes, ma'am, I'm here.
Yes, ma'am.
So thank you so much for the given the second positions for the paper presentations to all the jury members and all the dignitaries also. So thank you so much.
Okay. And the third winner is Russell, ma'am. Russell, ma'am, are you there? I think she is not over here. And for the poster presentation winner, the first winner is Shalini Deshmukh, ma'am. I think she is also not available. And the second winner is Dipanshi Chaudhary, ma'am. I think she is also not available. And for Fatima Aju, ma'am. Okay, no problem. I think no one is available over here. So once again, congratulations to all the participants and the winners. And I would like to thanks to all the participants and all the judges for making this international conference very interactive and very informative. So we will wind up for the session, and it's a humble request to all the participants, just wait up to Monday that we can provide you the certificates through your mail. If you haven't, if you will not able to receive the certificates and all, kindly just check your spam also, because sometimes mail used to go over there also. And if you after that also, after Monday, if you won't receive the certificates, you just directly message into the group, or you can just WhatsApp us the details that we can provide you the certificates and all. Okay. So once again, thanks to all of you. Hope all the sessions and the paper presentations were informative to everyone. So have a blessed day ahead, everyone. Take care. We will wind up the session now.